it's a money.
I'm like, that is hilarious. You got me good.
Well, maybe I'm later.
Yeah.
I didn't sit there on purpose.
Oh, am I there?
I just want you to know that.
I gotta connect to Brendan.
Right now,
That's why I
absolutely different. You have shared
I want us to
things in the
get
past.
Because the girl's not here.
We're using software called Screen Share rather than an HDMI cable.
Oh, okay. So, does Cassie have access to it?
She's right here.
There.
Wow, it is the Brendan
I
table.
let people hear.
It's not going to fall, but it's not.
Well, yeah, we're not in, you can log in.
Oh,
I didn't wear my green shirt today because you said what about that? I'm trying to do last
Sort that
night.
on the.
Oh, I would never have thought of that.
I didn't think about it either, but Lisa said, last time we were here, she was like, you can't wear a green shirt.
But I'm not up. Do you want me to minimize that?
No, well, when, we're gonna click on you when you present.
Oh, okay, so I can just get this ready to roll.
Yep.
It wasn't really weird.
And then you'll just click on it. Okay, well, that's kind of fancy.
All the things you're learning, Cassie.
It's insanity, just saying.
Brendan, I did end up taking.
I know.
Oh.
Would you like them to shred?
Yep.
Oh, really? I don't know what I thought that.
Well, that's fun. Oh, we know where they are. I never get to talk. Oh, quite all right.
So these are the minutes that I changed.
No, I forget to
I
get
amended.
Actually, I forget to ask Hollow.
That might be Jennifer.
Be right back.
Well, when she speaks, I'll just move the mic away. How's that?
Yeah, that sounds good. Well, this might catch it if it's right here, but.
Is this a different meeting? Is that
This is last week's.
No, he told me.
But I had sent the minutes, the draft.
Hey, Jessica, I'm gonna meet you. Nothing personal. In this room.
Oh, there you go. Okay, awesome. Thank you.
Because it's not for
Yeah.
so I know I changed it. The other thing is that I changed. I was tired. This morning, I just trying to get up this morning just was not.
Yeah, I know. I don't normally.
There are two Jennas in this room. That's going to be hard for me. Okay, Russ, here you go. Thank you.
red and green for red for mute, green for live?
I don't know. But I think you can pull it. Turn it off and turn it on.
Yes, I will.
How many people do you have want to sign up? Only 2?
I know Jess wants to say something. Sit so far.
Just remember, if there's more than 5, we need to vote to extend it.
Yep.
What are all these people here for then?
If everybody could just bear with us, we'll get started in just a moment. John, just let me know when you're ready. All right, we'll go ahead and call this meeting to order. Welcome, everybody, to the Newport School Board meeting. I'm going to call the meeting to order. Russ,
Medley here.
Linda,
Linda Waddenston here.
and Jenna Darling here. Can we all please rise for the Pledge of Allegiance? I
Pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. We have the public minutes of September 9th.
Adjustments.
Oh, I apologize. Thank you, Linda. Adjustments. All right, I have 2 adjustments. There's a brief NCTV update regarding filming of sports. And I also need to add a non-public under 91A32E. If I could have a vote on making those adjustments. Russ,
Motion to adjust the agenda.
second.
Second.
Okay. Roll call vote, please, Russ.
Russ Medley, aye.
Linda Waddenston, aye.
And Jenna Darling, aye. Thank you. Okay. Now we have approval of minutes of September 9th. Is there a motion on those?
Motion to approve the
Motion to
minutes of
approve?
September 9th.
Okay. Is there a second?
Second.
All those in favor?
Aye.
Aye. And the minutes, it says September 21st, it should be September 23rd.
Motion to postpone
To table?
the table that.
Okay.
yeah.
Second.
Okay. We will table those. And those are just some corrections that we have to make sure are in there. All those in favor?
Aye.
Aye.
Aye. Okay. Thank you. Okay, that brings us to public comment. I have one person here that has signed up for public comment. If you are on Zoom and would like to public comment, just raise your hand and Dr. Minahan will flag me down.
Might want to ask if there is someone that.
Oh, is there anybody else here that would like to sign up for public comment?
Okay.
Okay, seeing none, I would like to ask my other board members, I received an email from a parent of a student in the district who lives in Goshen and submitted her public comment to me to read aloud, but I would need a vote for that, a motion and a vote.
So a motion to accept and read those into the minutes.
Okay. I will second that. All those in favor?
Aye.
Aye. Opposed?
Opposed.
Okay. All right, and we'll read those minutes in. Okay, I'm just gonna add her name to my list. Okay, so we will start with Mr. Morris. You have your 3 minutes once you state your name.
Can I take my mask off so I can speak clearly? Anybody opposed to that? Anybody scared? Stephen Morris, resident of Newport, 3 years now. At the school board meeting in August of this year, several of us voiced our concerns about face masks. I asked about the COVID committee that was in the school district and whether any parents were on this committee. The response I got was that there are teachers whose children go to school in Newport that are on the committee. So still haven't found out if any parents are on the committee that aren't attached to the school. And I'd also like to know at some point what data or source they use to justify wearing masks. Is a decision, you all asked what the parents, and when we made that decision, you asked us that we're here to speak out against mandatory masks to ensure that our kids who did not want to wear the mask treated those other kids with dignity and respect if they chose to wear a mask. However, here we are 2 months later, and we have teachers, staff, and students harassing those who have issues wearing masks for prolonged periods of time. So the exact opposite has happened now. So what y'all were concerned about us, with our children who we do not support wearing masks, has now been reversed, and we have teachers, staff, and students harassing them. It's also been brought to my attention that some of the teachers have the capability to sit at their desk behind a piece of plexiglass and take their masks off. I'm not opposed to that, but that's an option that they have that the students don't have. But I have issue with it. It's an inequity for the kids who are harassed whenever they pull their mask down because of whatever is bothering them to pull their mask down. And then I also like to know, is our only risk assessment the number of cases in each school or the community? And I'd like to highlight again, in my previous career, we had to conduct risk assessments before doing just about anything that we were going to do. And the people that I worked with knew how the risk assessment went because I briefed them the risk assessment, and anything that was a judgment call that I made, I was able to explain why I made that decision based on my judgment, based on the facts in the risk assessment that I conducted. Not because, just because. I had to be able to explain why. So I'm going to go over some facts that I utilize to make my risk assessment that I do not think that my child, or any child really, needs to be wearing a mask at school. So if you'll just bear with me, I know I've got 2 minutes. And this is available on the National Institutes of Health website in an article published by Kizelinsky, Gaboni, and others, and it's titled, "Is a mask that covers the mouth and nose free from undesirable side effects in everyday use and free of potential hazards?" Their goal was to, quote, "find, test, evaluate, and compile scientifically proven related side effects of wearing masks." I'm only going to cover the ones that apply to children, but this is a very in-depth article, and it would be interesting for everybody in here to read it because it affects adults as well. But I'm just going to cover the ones that deal with children. And these are, unless I say otherwise, I'm quoting directly from the scientists that conducted this. Number one, there are clear, scientifically recorded adverse effects for the mask wearer on a psychological, social, and physical level. And those include, now this is not a quote, but I copied it down and it's in there. Physiological, internal, neurological, psychological, psychiatric, dermatological, ENT, dental, sociological, occupational, social medical, microbiological, and epidemiological impairments. Number two.
That's your 3 minutes, I'm sorry. If you could just wrap up. That's the timer going off.
I've already been talking for 3 minutes.
Yeah, I'm sorry.
All right, I'll let, you want to speak after me? You finish reading it for me? Elevated CO2 levels caused by the mask are known to increase heart rate, blood pressure, headache, fatigue, concentration disorders. Mask and face shields cause fear in 46% of children. Investigators were able to objectify complaints of headaches with 53% of the children, difficulty concentrating, 50% of the children, joylessness, 49% of the children, learning difficulties, 38% of the children, fatigue, and 37% of the children. And of those observed, 25% had new onset anxiety and nightmares. 60% of mask wearers showed stress at a level 10, and less than 10% had a stress level lower than 8. So that means 90% of children in this study had a stress level above 8. Masks block the foundation of human communication and exchange of emotions and not only hinder learning, but deprive children of the positive effects of smiling, laughing, and emotional mimicry.
Sorry, you've had your 3 minutes plus some. I have to let the other people speak. I'm giving them the same amount of time.
You can have my 3 minutes.
I can't do that. You're not on, nobody else is on the list. I'm sorry. That's why I asked before we started.
So that's how we play. Nice.
There's gonna be other parents that are late, so you can, give them what needs to be read.
Okay. Ms. Rothbart, you have your 3 minutes.
Hi guys, can you hear me?
Yes.
Okay. So, hi, I'm Jessica Rothbart. Unfortunately, I am not able to be there in person today due to the fact that 6 of our family members of 8 are COVID positive right now. I am using all the strength that I have had in the day to sit in this chair right now and speak with you guys, just so that you are aware that there are parents out there asking you to please keep the masks on these children. Sorry. Breathing is very hard for me right now. I've been very fortunate that my children have gotten by okay, being positive right now. But I wanted to make sure that people realize it affects everybody differently. My children and all of these children in this school district are important. All of the staff members. It's tough. Please do not take this lightly. Please think of these kids and putting them at risk. Thank you.
Thank you, Mrs. Rothbart. Okay. I have the third public comment that we voted on earlier. This is from Elizabeth Hall. She says, "Thank you for granting permission for my voice to be heard. In this statement, I would like to show my support for the continued masking of our students. I base my support on 2 peer-reviewed scientific studies conducted in the fall and winter of last year. One study was done in Wood County, Wisconsin, and the other in Salt Lake County, Utah. In the Wood County study, schools that required masks saw a 37% lower instance of COVID-19 than that of the surrounding community." That was from Falk 2020. The Salt Lake County study found that they were able to keep in-school transmission to under 1%. That's her show, by requiring students to mask. The results of both of these studies show that required masking slows in-school spread of COVID-19. We have seen this in our own schools. We know that the beginning of the 2021-22 school year has already seen more COVID-19 cases than all of the 2021 school year. I urge you to review both the scientific data and the real-time data unfolding before our eyes. Masking works and should continue to be required by the Newport School District. Respectfully submitted. Okay. All right. That closes our public comment portion for the evening. And that brings us to information and action. How about COVID update?
Will be auxiliary, will provide that. And there's no action at this time for you to necessarily have to take regarding those presentations. You can take it later. Okay, so is Mr. Howe here? Are we?
Right next to me.
What do I need to do to make
Perfect, it's
sure?
already on the screen.
Oh, perfect, thank
Do
you.
you need the other one on the screen?
Can we get it bigger?
Yeah.
It's on that screen. Thank you.
Excellent. Okay. Do I need to do that?
No, that's not her screen.
Okay.
Look at my screen. Oh my God. Okay, so I'm here just to give you some factual data, okay, about some stuff that's going on in the district.
Could you just move the microphone over?
Could you, first of all, if you stand at the podium, that would be better. Secondly, is that not on Zoom? I don't have a copy of that for the camera.
No, it's on her computer.
Oh, Okay, I'll just zoom this camera in on it.
Thank you.
Thank you.
If I can get a hold of it.
I'd like to stand there.
Do the
Sorry
best.
about that. I just didn't, I usually you give me a copy.
Sorry, I would like one.
Okay, thank you.
Okay. So, I'm going to I have about 9 slides to show you. I'm going to talk about some stuff throughout the district, and I'd be happy to answer questions at the end of the presentation, not kind of during it, just because I have to stay focused. And I will go off on a tangent. So, all right. So what I want to do is go back to September of 2020. We came to school in the high school, and I talked to Sue. Her data was very similar to mine during the month of September. So I'm reporting just on the month of September. I sent 40 people out for tests, and you can see how it's divided throughout the high school, CT, middle school, and the staff. There were no positive tests. Nobody was sent out to quarantine at all during that month. So what was different then than now? We had about a quarter of less students in our buildings. That enabled us to have more spacing. Spacing is a big deal when it comes to this. And our desks were at least 5 feet apart. We had less group work. There was more cohorting, classes that kind of traveled together, like the middle school classes, and masks were in place. Other differences in that, not up there, like in the lunchroom, there was more space in the lunchroom. Kids were spaced further apart because there were less kids in the building. So at Richards, there was more space in the lunchroom because there were less kids in the building, which kind of makes a big difference. Okay, so let's fast forward to this year. So these are just the numbers. So I have it broken down a couple different ways. So at Richards School for the month of September, 57 students were sent out for testing, 50 middle school kids, 51 high school kids, comes to 158 tests. And then I broke out the staff. So there were 19 Richards staff, 8 middle school, 4 high school and CT. There's 1 school-wide staff, and that means there's a staff person that works between the middle school and the high school. So they work in the whole building. 1 district staff, somebody that's throughout the district, and we had 1 substitute that was sent out. So out of that, we had Richards 18 positive cases, middle school 14, high school 6, meaning 38, 9 at Richards, 2 in the middle school, none at the high school. A school-wide staff was positive, a district staff was positive. All in the middle high school, all but 1 person was non-vaccinated. Okay, so that's an important thing to know. In the high school, all the people who were positive were unvaccinated except for 1 in the Newport Middle High School. So all the people who were positive in the middle school, the high school, and CTE, including staff, everybody was unvaccinated but 1 person. So we had 1 breakthrough COVID positive case. So quarantine, we also send people out of school according to public health if there's a household member that becomes positive. Any unvaccinated household members, those are people who live under the roof, need to go home and they need to stay at home and quarantine. It's typically they quarantine for the 10 days that the person who is positive that isolates, and then they have to quarantine for 10 more days, because in the first week, the person who is positive is shedding the virus. And if you're living in a household situation, this is an airborne spread, that person is breathing out the virus for the first week to 10 days, and the people around them can be breathing it in. So what's happened is that the person goes home who's positive, they get the family members home, which is what's happened in Miss Rothbart's house, is that 1 person gets positive, and then like 5 or 6 days later, somebody else gets positive. That then changes all the days for everybody else, because it goes off of the last person who's positive. So what we've seen is that in family members that are at home in the middle high school, you'll see that we had sent, 6 middle school kids home. 5 of them became positive while they were in quarantine. 2 high school students went home, and they both were positive. At Richards, they only had 7 out of their 15 people become positive. Thankfully, there's been only one person that's been hospitalized. They were in the hospital for several days. They've been out of school for a period of time, are working themselves their way back. In Richards, there have been 3 clusters. A cluster is, in September, is identified as 3 or more cases that can kind of be linked together. So, and these at Richards, I know 2 of them were in classrooms, 1 pre-K, which led to the pre-K closing, another classroom, and then a bus situation. And at the high school, there was 1, at the middle school, there was 1 in the 6th grade and 1 in the 7th grade. That we kind of think that that's kind of how that all happened. Okay. So next. So there are, according to the CDC and public health, there are these 9 strategies to help keep people safe. So the first 2 core preventive strategies are vaccination and face mask usage. Then there's the distancing and cohorting, screen testing, asking, like with parents asking their kids, you know, like, how are you feeling in the morning, keeping them home when they're sick. And we have had parents who do that. Like Sue and I get calls every day throughout the day. You know, my child is homesick, this is what they have, what do we need to do? And so we're giving guidance to those parents what they need to do. And it's great, and they've done that more this year than last year, which is awesome. I know with this lovely weather, windows are open like in our school all day long. People are going outside, utilizing that stuff. People are staying home if they're sick. We have absolutely people out of school. Isolation and quarantine, which I've talked about, and then Ronnie does a good job with the cleaning and disinfecting. Okay, so with these 9 things, what I want to do is show you a little video, because no one of these preventative strategies is 100%. There's no way. So it kind of takes all of them working together in order to protect us the best that it can. So let's see. I have that all the way out. Sorry, Ted, I didn't play. So I tested this like 5 times. It's only 1.5 minutes. Just.
Can I point out that the video just showed masks don't work and cheese slice 1?
Okay, so and when I look at those and those strategies, I don't just think of COVID-19. What I think of is all kinds of different things that are around, whether it's the flu, whether it's strep, whether it's chickenpox, whatever it is, the common cold. So all those things help to prevent the spread of any kind of bacteria. So some key points that I just want to make, that if you take away one of those mitigating factors, then you're supposed to tighten up on some different ones. So some things that are different this year, we have more kids, like I said earlier, in the building. There's much less spacing in classrooms. Desks are hopefully 3 feet apart, but not always. Spacing at the entrances in the morning and lining up for lunch is just not there. Kids are right next to each other. Being kids, I mean, that's just what they do. They want to talk to their friends, they want to fool around with their friends, I get it. I pointed out issues with lunch. I just know in our lunchroom, I know in the middle high school, we have 1 high school lunch, and with the nice weather, there are 4 kids to a table, and then half the kids go outside. When winter comes, that's not happening. Everybody's got to be inside. At the at Richards, they're sitting right next to each other now, inside. They can't, yeah, like kindergartners can't carry their trays outside to eat. It's just not going to happen. So that's an issue. Passing between classes, it's just, there are people right next to each other the whole time. We no longer do contact tracing. Last year, we did this thing called contact tracing with any positive case. That would take 2 to 3 hours to do per case. Anyways, where you would talk to the person and walk through their entire infectious period, and then we would identify people, then we would need to call the people, and they would need to quarantine, and it was a big process. But at this point, public health doesn't recommend that. All they recommend is that if there's a positive case in a household, the unvaccinated household members stay at home for the period of time that they need to stay at home. Vaccinated people can leave the house. They can leave the house. It's recommended that they wear a mask when they're out in public, and that people get tested 5 days after the original test. One of our goals, one of my goals absolutely, is to keep kids and staff in school. When kids are out and there's more infections, there's a greater loss of education to children. And that goes with people in isolation or people who are quarantined. Some of the kids, once they're home and the masks are off and they get infected, they're out for 20 days. That's a long period of time. Allowing parents to work. I know parents at Richards have to stay home with their kids or arrange childcare for their kids. That's a huge issue. You know, in our school, parents may be able to go to work and leave their children at home. Covering staff, if there are lots of staff that are out, is an issue. We don't have subs. So we're asking staff to cover another class, not do their prep, or do, you know, which becomes an issue. And then there's, you know, a big issue with people becoming like long-haul COVID, people who have these symptoms that last for an extended period of time. Mental health impacts from isolation, from being home, from being away from friends. Yeah, that's a huge thing as well. Before I do my last thing, I'm going to talk just a few minutes about on when we put masks on. So middle school put their masks on September 16th. High school and Richards put their masks on September 20th, and that's when those schools got to 3 cases. Over the next 10 days, which is, remember I said, it takes 10 days for somebody to breathe out the virus for other people to breathe in. So over the next week to 10 days, our numbers incredibly spiked. I had 10 people out, positive cases, 11 people out, 12 people out. On top of that, during that time, I'm sending 10 to 12, 15 people or parents are calling in, keeping their kids home, or staff are getting sent home. So that's 30 people out. And then, so as of September 28th, the numbers dropped off. So I went from the 27th, I had 12 people out in the middle school, 6 people out in the high school. On the 28th, it dropped to 7 and 4. And then from there, it's gone down. And now I have 2 out in the middle school, 2 out in the high school. It's kind of leveled off. I sent probably 5 people out, or parents call in, it's maybe 5 people a day. I have 9 people out now in quarantine, family members. Sue has about the same. Her numbers, so what happened with Sue is she had the preschool that got shut down later on, and then that snowballed out. So her numbers were still up the beginning of this month to 11. So her numbers, she's about a week behind us with the number stuff. Richards is. So that was just that. So now what I want to do is show you a website that I use all the time. So this is done by the state of New Hampshire. And you can go on here and you can find updated information. So this is on our website. I put in the newsletter all the time. It's got these maps that show you great information. So if you go to the dashboard, and then you get to these different maps. So I'm going to go here. So this map right here shows about the spread. We're in substantial community spread, the whole state is. And that's based on the amount of cases per 100,000 people and your positive test rate that you have. So what you can do from here, you can, I just can't see because of my glasses, go down and like hit the positivity, the test positivity rate, and you go over, you can see over here, this will be Sullivan County. So when you click on that, we're at a 12.5 substantial rating, to get out of the red, you got to be under 5. So one of, those things have to be under 5. And then you can go over here to town, and you go to Newport where it's 16.7, and this is over the last 7 days. You can go down here to Goshen, they're at 24%. So you can go around. You can see the active cases, again, through the county, and then you can go into, Newport right now is 64, so you can go in there and you can see like how Goshen, Leominster, Croydon, and all of that, all the schools, all the towns where they come. The other thing, you can go in and you can get vaccination rates. This will show you that the state is over 50%, but no, we are not at 50% of totally vaccinated people. So that's just something to consider. That's just going to keep going. So if you go on there, you can play around. You could find all kinds of different great information if that's what you're into. I'm a data nerd, so. All right. So we are going to go. Okay, and then the last thing I kind of want to put out, 2 things, is that the CDC, their recommendation, because the Delta virus is so transmittable, is that they recommend universal indoor masking by all students age 2 and older, staff, teachers, and visitors in K through 12 schools, regardless of the vaccination status. And that second paragraph really talks about like people at Richard School who can't get vaccinated, and right now they can't. Hopefully within a month that will change. And the other thing is this, the Public Health State of New Hampshire recommends the same thing. They just want people to know that the masks work both ways. They help prevent against the spread of the infection, and that they suggest that when a region reaches substantial, that people wear masks in school and child care settings. And so the only other thing I wanted to say that I forgot to say earlier was that Sue and I used the same criteria today that we did a year ago, when, and that's criteria put out by Public Health, that if anybody has unexplained or new symptoms, and we have a whole sheet of about 8, 9 things, that we ask them to get tested. The state currently just opened up a new site over in Claremont, a PCR site. And so we send people, typically either go to the health center, they go over to urgent care, they go to Rite Aid, they go to Clear Choice up in Lebanon. They do a rapid test at Clear Choice, and I've had people go up, bring their kids up, have the test sent, return the kids to school with the rapid test results. So they're out of school for like 3 hours. We've had some parents do home tests, and they take a screenshot of the home test and they send that to us. And that's an instant thing. I got a call recently about a parent saying, didn't think the kid was positive. They did the home test, and it was fine. She was like, oh my God, it's positive. So, and then the new site just opened back up over River Valley. The tech center. So, and their results are like 12 hours or so. I've had 2 results, and that opened yesterday, and I had 2 people go there between yesterday and today. So, okay, so that's my deal. So, any questions? I guess I'm around to answer.
Thank you, Ms. Seeley. Any questions from the board? If you could just hang on, the board's not taking a vote right now, so if the board takes a vote, then we can have public comment on this topic. Okay, thank you.
There's some people that came late, they can't speak for 3 minutes.
Nope, not right now. Okay, Linda?
I have some questions. If you just look at the audience right now, is this what a typical classroom would look like?
My experience in the hallways, because I'm a big person in the hallways, and I say, can you pull your mask up? People will pull it right up over their nose, and I thank them, and I appreciate that, and I tell them that, thank you. And I would hope that teachers in the classrooms would do the same thing, that if kids have their masks down, that the teachers will say, please put your mask up, and people will comply with that.
Okay, Linda, what are your other? Okay, listen, this is our turn now, okay? I understand this is not a fun topic right now,
I understand your
but
whole, where you had to sign that paper to speak, but I've never been to a school board meeting, so.
Okay.
That was fairly, I thought it was for the paper or something, I didn't realize that it was.
okay. Linda, what are your other questions?
My other question to you is this, is that I'm definitely not a COVID expert by any means, but
Neither am I.
it's transmitted through fluid. Is that correct?
Respiratory droplets.
Okay. So really the mask prevents the droplets from going in or out
Correct.
if it's worn correctly.
Yep.
But if you have any kind of, can you just chill out for a minute? I'm trying to make a point. If it's loose in anywhere, there's no guarantee that that's happening.
Right, if it's down below the nose.
If it's down like this.
Yep, that's just not
Or
even
if
have
it's
it on.
loose here.
And that's where spacing comes in, that's why it's multiple things, and that's where spacing comes in and trying to keep people at least 3 feet, like in the classroom, 3 feet apart. Doing, it's just, and reminding people, I think what I've seen in the hallways from when we first began to now is much less asking people to lift their masks up.
But, I'm a little bit disturbed that we have teachers sitting behind plexiglasses, if that's true, without masks on, because
Yeah, I'm unaware
that's
of
not
that.
preventing anything.
I will like it,
Probably tell you that, I know.
so.
The second thing is that, are we going to be presented anything about the environmental cleaning, some of the other aspects, or are we only being presented about masks?
Well, we're being presented by what Cassie has for you. They do, as I said prior, they do the cleaning and all of those things on a regular basis. If you want either Ed or Rodney to come and speak to that, I can do that.
Yeah, I'm just curious. To me, I understand that Swiss cheese effect, and I understand that the majority of people are unvaccinated, and that's their choice. Unmasking or masking, that's a person's choice as well. But there are certainly things on that cheese chart that we could be doing that sometimes doesn't.
One of the things, if I may, that's important about the cheese chart that Cassie spoke to, though, is that there are 2 core prevention strategies.
Yeah, I get it.
The rest are underneath that. And so in hearing from Dr. Chan, the state epidemiologist, he has even said, like in the lunchroom, the plexiglass, it is a mitigating strategy, but take it down because so kids can intermingle, I think,
kids, yeah.
for lack of a better word. But the 2 primary ones were vaccinations and masks.
Sure, I get that. But still doesn't change the fact that we have kids, and depending on how they're wearing things and they're sneezing, I have allergies. My eyes are running, so I'm touching my eyes, and then I'm touching here and touching Jenna, and, So it's a matter of the multitude of things. However, if somebody feels really strongly about wearing a mask, they can certainly do so as well. If they feel strongly about not wearing it, then, that's the chance they take. They have the opportunity to get vaccinated too, which makes them in a less greater risk category. But just trying to really, I just look out here and my kid's not in school anymore, but I certainly know that the kids, some do it, some don't, some teachers do it, some teachers don't. There's no universal, everybody's got their mask on, secure, nice and tight, and walking through, and,
Well,
there's...
I said it's not 100%, but the numbers clearly have indicated once everybody was in a mask, wearing them, how we're wearing them, is that the number of cases that were positive has gone down, and the number of people who need to be sent out for testing has gone down.
And outside the school when they leave.
Yeah, so even if we go back to the original proposal, it's probably more than likely we're gonna end up with masks on anyway. But it's theoretical, so we're really just kind of playing with that whole theoretical advice here. So, just my comments.
Yeah.
So the transmission rate, the transmission is 10 days, and then is there an incubation period?
Well, that incubation, yes, so it would be, so the transmission date say, me and my husband, okay, so I have COVID, and so for the next 10 days, I'm breathing it out. He can be breathing it in, okay? And then if that next 10 days is the incubation period where it's going to come out, if it doesn't come out in that second 10 days, that person is free to go about their business.
So how long has the schools have been in masks for? 3 weeks? For 21?
Yeah, like you said, and they were pretty close. So the middle school went in on the 16th of September, and then the high school and Richards went in on the 20th, which was a Monday, the following Monday.
And so this week for Richards and the high school is the 3rd week?
Correct.
So how, and I know you presented this, how much has new cases, how has that declined?
They have continued, since the 28th of September, except for at Richards, they did go up because they had the pre-K, and that was in that classroom, so that kind of, and they're a little bit behind us. So my numbers have continually, since that day, since the 29th, gone down every single day.
And the numbers of, that's the number of new cases? Or
That's the number of new cases,
active
that's the number of, I only have 2 active cases right now, or no, 2 in the high school, 2 in the middle school, because I got 2 today, 2 were reported today. That's the number of positive cases, that is the number of students being, or staff, so it's students or staff. And since that time, we've had no positive cases in staff since September, at the middle high school, since September 27th. That's the number of, every data point that we have is gone down since then, considered every single day. So I'm down to, today I asked, between asking and I had I think I asked 3 people to get tested. 1 came back positive, and then 2 other parents called in and said they're keeping their kids home. Or what should we do and whatever. So there were 5 kids today. So.
Thank you.
You're welcome.
Brendan, did you have anything to add?
Do I have anything to add? No,
I just want to make clear that we've been asked a lot, can we go remote?
So that's an interesting question. The commissioner has said that a law is coming forward about that you can't go remote, and that he wants us to not go remote. And even though the law hasn't been passed or the rules haven't, there are some districts I just saw today that Monadnock is going remote for a few days. Manchester went remote for a few days, and Raymond went remote for a few days. And so we have been trying to not do that because probably at some point the rule will pass. But however, if the board wants to go to something where we go remote, although I know at least the staff that I've talked to don't find that preferable. I'm sorry?
I can't hear you. Can you speak up, please?
I can. Is that better?
Thank you, yeah.
Okay. So I was saying that some of the regional schools around here, around the state, have gone remote, even though the Commissioner of Education has told us to only go remote for weather-related purposes. But I was just saying that I know at least the staff that I've spoken to at both the elementary, middle, and high have felt that at least having the students in class is preferable to going remote.
What are you guys doing for children that have COVID or that have to wait 3 days to get a test?
So the kids who are out due to testing or due to COVID, oh, I'm sorry. Yeah, I've gone rogue.
That's okay, go ahead, you started.
Excuse me. So the children, if a student gets identified as having COVID or whatever, the teachers make the work available if the kids can do it. Now, we've had situations where they haven't felt well enough to do it. What I see are the messages going back to the families or to the students saying, hey, Johnny, I have this work for you. If you're feeling up to it, you can do it. If you have questions, let me know. Elementary, it's probably a little less so.
So that's part of my conversation with parents. I talk to them. And they say that they're positive. We work through all this. I say, does your child have their Chromebook? And if it's yes, it's yes. They can access, in this school, all their assignments are in middle school on Google Classroom, and in the high school are in Canvas, and so I review that. We've had kids who have forgotten their laptops or didn't have one. And so in one particular case, I said to Mr. Ronning, this family is going to be out of school. We need to get stuff to them. And so it was brought to them in that case. So that is part of our initial conversation. I always tell the parents, if the kids are having problems, have them email their teachers. They can do a quick Google Meet. I always use math, Mr. O, because it's just confusing if it's a new concept. So that's always part of our initial conversation, and asking the parents to reach back out. And I've had parents reach me saying, I can't get a hold of, the ELA teacher isn't posting something. So then we make that happen.
Can I ask, Ms. Ferrigno, what does that look like at the elementary level? Because our students don't bring home their Chromebooks every day.
Correct. So, again, if the children are feeling well enough, we will deliver them. Today, during my lunch break, walked up to a student's house and delivered more work because I felt like it was important. Not every parent is capable of helping in that way, but if they ask for the work, we provide it. But right now, like last year, we also had a system where we were remote, or we had teachers who were remote who could then teach remotely. Right now, we don't have a system like that, and we are not doing any of this asynchronous teaching either because we don't have any kind of framework for that. So if parents ask for work, just like in the old days, if a kid got strep, we send work home, but there's no online component. They do, when we send them their Chromebooks and we send the work home. And that's what happens at the elementary school. But again, I mean, they're smaller, so if the parents can help, it works great. So not everybody can. And then those, we have students that were out for 10 days. That's a long time for a first grader to be missing instruction.
Thank you. Ms. Healy, the plan that the board accepted prior to the start of school, that the board voted to adjust, so instead of going by community transmission rate, we voted to just go by the number of cases in the school. So, and then we voted to keep masks on until this meeting. Can you please remind me, what are the numbers tomorrow? Who would be wearing masks? Would any of the schools?
Richard's entire school would be wearing masks.
Okay.
Tomorrow we are I'm at 2 and 2.
2 and 2.
2 in the middle school, 2 in the high school.
Okay. Okay.
Today. Sorry.
Just for another point of information for folks is, driving in this morning, they were talking about, the highest rates of positivity, and they listed 3 places. Lancaster, New Hampshire, I think it was Gorham, Berlin, New Hampshire, and Newport, New Hampshire.
Great.
So you made the
Okay.
news.
Yeah. Okay. Linda.
I know that I shared this with you and the superintendent, but I just think that it's just worth mentioning. It is not in New Hampshire, but Bentonville, Arkansas, I think it is. Let's see. Yep, Arkansas. Bentonville, Arkansas. This is something that was found in Bentonville, Arkansas. But it's just something to note that there was a lawsuit filed by parents about masking. And they felt that it was, the mandate violated the parents' rights. And the judge did find that the school has no authority to do a mask mandate, and that the suit claims only the governor or the secretary of state have the legal authority to issue mask mandates and set quarantine rules. And I know that those little bleeps are coming out here and there more often now. It is unfortunate that we have a government that is trying to put this on our shoulders, but it's just worth noting.
Just so people know, I think there are currently 2 or 3 cases in New Hampshire. So I don't think any have been resolved yet. But so some have been filed here as well.
Okay.
4. Okay.
There's more every day, yeah.
Not,
Not till we make a
Not
vote.
until there's a motion on the floor.
You've all received a letter from her, did you?
I
From
gave it
Rebecca
to the
Lobesman.
board,
Yeah, I just got it.
Yeah, I
prior
know.
to the
She
start
just
of
got
the
it to me,
meeting.
got it to us today, so that's just
Okay.
her views with substantiated evidence of the importance of mask use, so.
Okay. Thank you very much.
You're
I
welcome.
appreciate that, Ms. Seeley. Is there any more discussion for the board? Are there any more motions? Oh, Dr. Minahan, sorry.
I'd just like to say too, sorry.
Oh, I was just going to
Go ahead.
say, if you are going to make a motion, not to make you guys stay longer, but I feel bad that the 3 guidance counselors are
Yep.
hanging out
Okay,
somewhere back there.
I understand. This is really important too. All right, Linda, go ahead.
Yeah, I mean, I think it's, the mask, I do agree that the masks help prevent the droplet spread if it's correct. I do have a 91-year-old dad at home who's a year out of cancer, so we do practice safe measures because of him, but that's my personal choice. I know people ask me, would you do it if you didn't have that at home? I don't know. I mean, crowded situations. I mean, I go to the football games. So, I do really feel a lot of it's personal, but I think that I'm a big proponent of being vaccinated. I'm vaccinated, I have my booster. I think that is a responsible thing to do. I think if you're sick, you stay home. If you are a family that feels strongly about masks, as we were, we taught our family, wear the mask because we love Grandpa, we want him around. We don't care what other people do. But I just feel cautious by just looking at our audience here, and I feel like I'm looking at a typical, at least high school classroom. So, just a comment.
Okay.
It's not that I'm for or against, it's just a personal preference.
Yeah, yeah.
So do
Russ?
we need a motion to get the conversation going?
Yeah.
Okay. I'm going to move that we follow the recommendation of the committee at the end of the summer. So the group that decided the original decision about masking and prevention, I move that we follow that.
So no change.
No, it is a change.
No, it is a change. So his motion is to accept the plan that the administration put forward prior to school starting, which is masking was based on community spread.
Okay, I wasn't here, so.
You were not here for that one, and so Russ, Rhonda, and I voted to go by the number of cases per building, which is what I was asking about before, which was we would mask up when there was a cluster, which is defined as 3 or more cases that can be connected, and that is what we voted on prior to school.
So that's the current policy.
So that's the current. Russ is making a motion to go back to the original one that was proposed to us.
Of community spread.
Of community spread, yes. And I will second that to have discussion. So because there is now a motion on the floor and a second, if there is public comment, you are allowed 2 minutes to address the board, okay? And then we will time that. I ask, please.
May I ask if they go to the podium?
Yes,
Yeah.
please go to the podium. I also ask to please be respectful. If this gets out of hand, this meeting will be adjourned. This is our business meeting. We are trying to make the best decisions for all of our students. Okay? So, just by a show of hands, who would like to speak, and then I will call on you to come up to the podium. Yes, ma'am. You have to come up to the podium, state your name.
Your name
you'll
and
have-
residence.
And you'll have 2 minutes.
Andrea Thurber, resident of Newport. I have 4 children that are in the school of Newport. My son obviously wears his mask like this. He was asked to pull it up. He was going to have to serve 3-hour detention. I feel that's not acceptable, especially when our school doesn't give detentions for children that are late. I mean, that would be a reason to give a child a detention. I do not feel that the masks are working. I have been in contact with many people that have COVID. I've only had one child that had COVID, and he's perfectly fine. The rest of them have been fine. And if you guys do this, I mean, we are going to have a lawsuit. I mean, there's plenty of parents that are on the same thing as this. It should be a personal choice. I believe in hand washing, sanitizing. I mean, that's the best thing. It's going to keep spreading. I mean, it is what it is. So, thank you.
Yes, ma'am. Come on up to the podium.
Hi, my name is Zeta Morris. I'm a student here at Newport. You know, we had masks all last year and still had the worst types of cases. We had to go home. We had to wear them during basketball season. And imagine being in a hot gym, playing your heart out, and you're wearing a mask when you already can't breathe or catch your breath, and you have to wear one on the court with other people who are touching the same ball as you. You're touching your mask the whole time, pulling it down. You're doing, like, I don't know. How does that make any logical sense to be in a gym and you have to wear one while you're playing, but when you go onto the bench and sit next to each other, because we could all sit next to each other, but we could pull our masks down and take a drink of water. Or, I mean, I go into class and I can't, when teachers talk to me like this, I'm already hard at hearing. I can't see what they're saying. I have to read their lips. It makes no sense. And, if somebody gets sick, they get sick. Everybody's at risk for everything. If you get the flu, the same thing can happen. I just want to talk on behalf of the high school. I know all the football boys would be here if they could. They're at practice right now. And I know they agree with me. They wanted all of us to come out here and talk about it. And I just think that, I don't know, it just makes no sense. And if you think that doing this is being effective, then, and if, you wear it the proper way like this, you can't touch it at all, you can't touch your face, you can't do anything for it to be worn properly, because you're still spreading it some way or somehow. And if they want us to do that, then they need to have us up in hazard suits. And that's how it won't spread. And if they all want us to come to school, then that's how they'll do it. And I know my parents, my friends, my family, they all agree with me. And I think that masks should not have to be mandatory. And if somebody wants to wear one, then that's their choice. Thank you.
Anybody else?
This should be Tim Beard, this should be the simplest decision, because you have kids that want to wear them or parents that want their kids to wear them, and you have parents and students that don't want to wear them. So I just don't understand why it's not okay. Tell you what, if you want to wear a mask, then you can wear a mask. If you don't, you don't. I don't get that. So instead, you infringe on our kids' rights and our rights, because these are our kids. We make their health decisions. You do not. Your job is about the education of our children and budgets and all that stuff, all that unfortunately boring stuff that I wouldn't want to do. But that is yours. You're not doctors. You're not nurses. The Arkansas lawsuits, just to start, there's already 4 in this state. There will be more. These are our children. We're not asking you to take the mask off. We're telling you, you're not masking our children anymore, because these are our children.
Monday comes, they're not going to have their mask. I'm telling you that right now.
Which one of you guys are going to say, okay, you know what, if your kid has any side effects from long-term mask use, we're going to step right up and say, you know what, that's our fault. We're sorry, because there's no studies about kids wearing their masks for long-term, what kind of damage that does. There's no study, because this is such a new thing. But if these masks work so well, there wouldn't be any COVID anymore. Because remember, we masked last year, we did everything. And as far as the numbers rising, they rose in the whole country. They spiked through the roof, and they've all dropped since then. And not the whole country is wearing masks, because in Florida, some do, some don't. The numbers are the same. My nephew goes to school in Myrtle Beach, South Carolina. They don't wear masks. Their kids aren't dying. No kids are dying in this state either. God forbid. I wouldn't want anyone's kid to die, but you have a chance no matter what. We had 2 students die in a car accident not long ago. No one's here saying, man, we should put seatbelts in buses, or we should talk about, drunk driving, or any of that kind of stuff that would affect that. No, it's fear, 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 fear. I feel for that woman, but I'm telling you right now, your children are going to be fine. I've had a lot of COVID in my family. All my family's been fine, except one member who had COPD very bad, that he was going to die from it no matter what.
Ma'am, did you want to say something? And then John?
My name's Angie Bolio. I live in Croydon. My son attends school here. I just really want to say the same thing that they've all said. I think that masks should be a choice. I kept my son home last year and homeschooled because he didn't want to wear a mask all day. We waited to re-enroll until I saw the draft reopening plan of masks being optional, which was the deciding factor in him coming back to school. And within 2 weeks of being back at school, he's had to wear a mask every single day. I guess it was my misunderstanding, maybe, that whenever we were under 3 cases, we were going to be mask-free. I didn't know that it was going to be up for debate, and again, my mistake, that it was going to change and that you were going to force our kids to wear masks. I probably never would have re-enrolled him had I known that or considered that. And I know someone else had mentioned already that as soon as these kids walk out these doors, they're taking their masks off. They're all hanging out together all night. They're playing basketball at the courts, sweating all over each other. You know, they're you know, wherever they're hanging out. I probably don't want to know half of what they're doing. But they're not wearing masks when they're doing it. When they come to my house and hang out, I'm not making them put a mask on when they come in my house. So I don't understand why we're going to force them to wear a mask when they're sitting at a desk trying to get an education. And if there are parents that are afraid and there are kids that are compromised, let them wear masks. That's fine. But don't force my kid to wear one. That's all I want to say.
John, and then
To speak to the issue on the other side, first of all, of course, it's not like a car accident. Oh, sorry, John Lunn.
Speak up, too.
Of course, it's not like a car accident, but a car accident, we do have safety features. We have seat belts, we have airbags, we have everything we can do that mitigate damage. That's what we're doing here. We're mitigating. We're not. Obviously, we can't do 100% to cure. The masks are meant to slow down the progress of the spread of a disease, just like those things in the car. Also, when it comes to health issues, we do look after the health of the children in this school. Where, you know, we serve breakfast. We have to serve. There are issues of kids that come to school that are in trouble. There are emotional issues, and the school it seems to be dealing with that constantly. So to say that we're not looking after our kids in a holistic way is not really true. I know that people have a problem that there are all sorts of negative effects of wearing the mask when it comes to the hearing people, the emotions, different things that are going on. But none of that doesn't mean that these other things don't exist, and that the masks are not actually improving the situation. They aren't curing it. They're simply improving it. Now, whether that's worth it or not is obviously going to be the decision of the healthcare officials and the school board. But it's not a useless thing.
My name is Carrie Greenwood. I have twins at Richards and a daughter at the middle school. I believe masks should be a choice. I know of a family who is COVID positive now. Their children play soccer with my twins, and they push masks for school, and their children play soccer with no masks. There is no child down at the fields that play soccer through the rec. No kids wear masks. No kids wear masks for any sports. And I just feel that, you know, if you're going to push your kid to wear a mask at school, you should push it 100%. If you don't want your kids to wear a mask, then that should be on you. My twins are both ADHD, and every single morning, it is the it is World War III at my house because, especially with my son, having his face covered is one of his triggers. And he literally, he can't handle it. And for him to go to school and sit at school all day long with a mask on his face is miserable. So when he gets home, he is like, he's out of control. I have all I can do to control him because he has to keep cool and calm and collected all day long with a mask on his face. So when he gets home and he can finally take the mask off, then he literally, all of his walls come down and he is the biggest handful to deal with. And I feel that if a child has issues, they should be able, the parent should be able to say, my child does not need to wear a mask. I just, regardless, like, I feel if you want to wear a mask, that's your right. If you don't want to wear a mask, then that's fine. Same thing with vaccination. It's a free country. We should be able to do what we believe in. And not being able to make a decision for my child, especially when they have an issue such as ADHD and having their face covered, like, I have to tell my child, there's nothing I can do about it. Well, why can't you do anything? You know, I can't do anything because they said if you're not going to wear a mask, you're not allowed at school. That's not fair to my child. That I have to tell them they have to cover their face when it's such a trigger. It's not fair. And I just feel that it should be the parent's choice. That's it.
Melissa Mitchler. I do agree that we don't know the long-term effect of wearing a mask, and we don't know what the long-term effects are going to be of getting COVID either. I do agree that it is our job to educate students, and it's very difficult to educate students when they're gone for 3 weeks. It is very difficult to get them caught up. My classroom is just now getting back to not being a revolving door. Cassie's facts are showing us that it's going down. Linda mentioned lawsuits. There are also lawsuits out there that parents are suing because the district did not do enough and their kid got COVID. There's also workman's comp claims that are starting to come out from staff members catching COVID. Thank you.
I'm Annalie Hall. I'm also a student at Newport Middle High School. I believe that masks should be optional because it's our body. We should be able to choose what we wear. We choose what we wear when we wake up in the morning. Also, if we want to talk about mental health when being quarantined, we should also talk about how we get worse acne when we have to wear these masks. And that is a self-reflection thing that can affect people's mental health. And people spend so much money on that stuff. And yeah, I just think that it should be our choice. And I respect people that want to wear their masks, so I should be respected if I don't want to wear a mask. Thank you.
Lisa Frigno, first grade teacher. I teach elementary school where the students do not have a choice and cannot be vaccinated. Also, the children that were in school last year wore masks all day and did just fine. This year, children can wear masks, do not have to wear masks when they're outside. So when they're playing soccer at the rec, they're not wearing masks because they're outside. When children go out for recess, they're not wearing masks because they're outside. And Mrs. Healy had talked about that the fresh air, it dissipates. But I just want to urge you, I am in my second round of COVID in my classroom. I cannot get these kids caught up if they keep missing 20 days of school. Last year, it was seamless. We had a few times when we had to go remote, but students were able to be in school, and they were taught. The little kids at Richards can't be vaccinated, and frankly, they're just fine with the masks until someone tells them, you shouldn't have to wear that. The kids that are in the building this year were wearing them last year, and they were just fine. But they are not going to be just fine if we keep denying them their education because they get exposed to COVID and have to be out.
Stephen Morris, resident of Newport. Apparently, y'all think that I was making up what I was saying earlier, so let me just go ahead and finish it. Number 7, since we mentioned the CDC up here, none of the high-level institutions, this is from doctors that work for the National Institutes of Health, none of the high-level institutions, this is a quote, such high-level institutions such as the WHO, European CDC, nor the US CDC substantiate with sound scientific data a positive effect of masks to the public. So I also want to add that while I appreciate the hard work that the teachers do, it's my kid, my decision. If she doesn't want to wear a mask, I support her because my kid's a little bit older. And the fact that you think that they're doing okay in learning, there's evidence that I have quoted here. And you can go look up the article and get away from the fear and the emotion of it and look at it through a practical lens. Elevated CO2 levels, fear in children, headaches, difficulty concentration, joylessness. I don't want my kid joyless for 8 hours a day because somebody's scared of you, like it was said before, and it was tried to be addressed. There are other things more dangerous than the dying of COVID for our children. And I understand that there are family members who are at risk. I have the same thing in my family. My mom and dad are older, they have issues. If we're sick, we're not gonna go around them. If they're sick, you know, we're gonna take care of them. But don't try to make me or my daughter or anyone else put on a mask because you're afraid, because there are far more, statistically speaking, ways that can harm our children worse than COVID, and they're easily findable on the internet. Looking at the data sources, you can find them on any scientific article, the CDC, if you want to use the CDC. I'm not going to say them because we're at a school board, but there are far worse things than the percentage of dying of COVID. So I appreciate the consideration. This is a legitimate article. It's not made up by Steve Morris. Thank you.
Hi, I'm Jacqueline Lord. I have a 13-year-old son that is in this school district. He comes home every day crying because he has to wear a mask. It gives him headaches. On the other hand, I have a 16-year-old who is very privileged to be back into the school district. She is very happy to wear a mask. Go for it. I will let you. But my 13-year-old son should not have to be made to wear a mask because he comes home with migraines. This mask system, you know, if they want to wear one, let them. If they don't, that's their privilege. If they want to get sick, let them. You know, they will learn. We have to let them learn. We can't decide for them all the time. Yes, I have one without, wear one without a mask. I also have a doctor's note. So, I mean, I have asthma, and I've got both my shots. I also got COVID, and it didn't protect me. And I wore a mask for 6 months. And my asthma flared up even worse with it on. So please do not force our children to wear them, because they are going to end up hating school. And it's going to be a struggle every day for parents to get their kids to come.
Further discussion from the board?
Yeah, I mean, I think, you know, it makes sense, like the personal responsibility and the personal choice makes perfect sense to me. The challenge that I have with it is that there's a greater public good that's kind of a school responsibility. So if we had asbestos in the school, you know, that would be our responsibility to clean up. And if more kids are getting sick and then spread it to the community and contribute to that.
Please let him talk. I've given everybody that wanted to 2 minutes.
As a member of the previous member of the armed forces, I take offense to collective.
Okay, Mr. Morris, I need to let Mr. Medbury speak.
as I'm thinking out loud about the balance of the two things, there's personal responsibility and there's public health issues. And it seems like a school responsibility to look after the public health of not only the students, but the families and the employees of the place. So that's my struggle in thinking about this, is kind of that balance of those two things. And when we get evidence that says you wear the masks as a precaution with vaccinations, with spacing, with cleaning, that it becomes we see the rates drop. I mean, that's just the reality.
All right,
Well, I'm talking about right here. And I have to say that I was fairly quiet. I don't think I responded or interrupted anyone else. I'm trying to have a conversation and talk about what I'm thinking about this. If you all are interested, I'm pretty sure there are some seats on the school board that will open. Please run. Please. So that's really the challenge, the debate that I see and that I hear is my right to choose what I want, my right to choose the things that I do for my children, and to not interfere with others, and then the responsibility for preventing spread of illness to other people.
I agree with you. Linda, go ahead. Go after you.
I understand what he's saying, but it is still October. It's still nice out. I feel like what we had in place originally is fine until winter time comes. We have to start closing up the buildings. And then we could have another discussion about it, but that's my opinion. I also just want to state to people that we are a 5-person board here. We have 4 active members and 1 member, Mr. Spalding, who shows up and leaves. And so I just want to point that out because I'm sure that he's probably a proponent of what you are asking for, and there's nobody here for that vote. So when you elect people into board seats, you should be thinking about who's going to show up and voice your opinions for you. So what Russ says really makes sense about having empty seats on this board, because if you're not coming to be a board member, to be an active participant, it's very difficult. While Rhonda's not here tonight, she's actually at a municipality training that she has to do for work, which is a legitimate excuse for not being here. But we need people that will work on this board and be able to come into the schools and represent you, your children, this community. 4 of us have put in a lot of extra work because we have somebody that refuses to do anything but say they're here and leave.
My concern, this is,
Who'd you vote for?
She was a board member.
And I served on the school board for 8 years, so I know it's a thankless job, and I appreciate what you're doing. I'm begging you.
So are we
to
taking
serve
public
us.
comment from the audience again?
no. I'd like, please, the public to let the board work this out because we are being tasked with what feels like an impossible decision. Absolutely impossible. In which we will be made out to be the bad guys no matter what decision we choose. That sucks. Sorry, that sucks. So whether one of us or any of us vote to make masks optional because it is your right as a parent, or whether we choose for the greater good and to the support of the staff, we're wrong. We're wrong, no matter what we choose. We've heard complaints about learning loss from parents and what are we going to do about it? And we have an option to maybe help prevent that. And now we don't want that, we want it to be our choice. I have 3 kids in the district. One of them has been out of school because it was closed for 10 days? 10 days. Closed. So I'm really at a loss as a board member. Really at a loss. Anything else, or are we going to vote on this?
You're the chair.
All right.
Can I don't know, Brendan, do you have the plan, the old plan, the original plan, access to that? So
Do I
that,
have-
because Linda, I don't think has, unless you already know what you're voting.
Are you talking about the original reopening plan?
The original was based
Because
on.
that's the motion.
Yes.
Yeah, community spread. Originally, it was based on county data from Sullivan County. I know that there was a conversation at that particular meeting whether to go county or Newport specific, and that's when they decided, they being you, decided to go to the 3 cases per school model. So I would have access to give it to her, but it's deep in my files, so.
I do watch the board meetings when I'm not here.
No, I know you do, but.
All right. Linda just said she watches the board meetings. Okay, we need to take a vote. Go ahead.
Is that right?
I seconded it. Okay. All those in favor of returning to the original reopening plan, which included masking when community spread was above,
It was substantial.
when it was substantial? All those in favor?
Aye.
Give me a minute. All of those opposed?
Aye.
Aye.
Okay,
That motion fails, but we're not done yet.
yeah.
What the board voted on prior to school was that masking would be optional unless there were 3 cases in the building. That will stay in place as of tomorrow.
Unless there's an emotion.
Something changes, unless there's another motion. So are there any other motions?
There's not a motion, but I think that it should stay in that fashion, and then we should reevaluate once it gets colder and things are closing up. I would agree to that.
So do you want to make it
No,
temporary?
it's just a
No, I
statement.
mean,
There's
it
nothing to
just,
move.
it is what it is. Okay. Then the original motion failed.
Can
So
I just get clarity?
Yeah.
Because I'm trying to take that.
Nope.
So you're saying that the hold off where we did the masking until today, that will end?
Yes.
And we will revert back to what we were doing at the beginning of the school year?
Yes, which is
Okay.
if there are more than 3 active cases in the building, that masks will be required.
Okay.
And this is what I'm going to say to that. We have said last time that we need to respect those that choose to wear a mask, and that should continue. And I think we should ask, when masks are required, that they be worn correctly, in a nice way. But listen, these are kids. You don't need to make anybody feel bad because they made a mistake or they have it below their nose and it fell down. Just ask them politely and move on. This is an impossible decision. I understand lawsuits are at stake, but join the board and take this side of the table because it's hard. It's hard. So we're gonna.
Could I just ask one more thing? This woman out here has a son with the ADHD that has a trigger with the mask. that seems like that should be a medical issue discussion at the school.
That's not my job.
Gets a medical exemption, can bring that to the school and can work with the person's case managers, all of those types of things. We do have some a religious one, it would depend. They are very hard to get, from what I understand. I know other folks can get religious exemptions for certain shots and stuff. My understanding is, I'm sorry?
People with PTSD?
No idea. I'm not a medical doctor.
If they bring a note from
And I'm not, well, it would have to be, I think it's a specific exemption form. I don't know personally, but that's my understanding. And I think the same would be true for religious exemptions, but I've been told that they are very tough to come by, so.
I think they should call the hotline to get information about,
You mean 211?
yeah, about exemption and stuff
That could be
like that.
true, I don't know.
Okay.
Jenna, along those lines, I mean, I think it's also important maybe to talk about kind of the tension, punishment. Yeah.
Well, I think there's two things. First of all, I did want to share, because Patrice reminded me, we do have desks with plexiglass, which for some students, that's what they use as well. But I think there's some misperception a little bit. There's a difference between a student who is, goes like this, takes a break, that happens. And then, as Ms. Healy said, she goes, hey, Johnny, Sally, whatever, put up your thing. There are also cases where there are a small group of students who it's probably 10 times in a class, and the person's basically like, tough, too bad, I'm not doing it. And so I think when you're talking about discipline, I don't believe, for the most part, that the staff are mamby-pamby handing out 3-hour detentions. I think if it occurs because the person continually disrupts and fails to follow that school rule. Excuse me, I'm speaking. I know you like to speak when I speak, but please stop. So that's my understanding. I know that Shannon can address it.
Yeah, I'm happy to speak with it, and some of you have talked to about this. Really, it's a 3-hour detention, first off, has been in our handbook for some time. I don't recall exactly when it originated there, but it has been one of the things that has been in our response to intervention type of things for students. There were approximately 5 students who were issued a 3-hour detention related to mass. Just so you know, it was not a school-wide thing. And those students were students who were repeatedly requested, please pull your mask up, pull your mask up, pull your mask up, without any change in that. We are, I think, in many ways more accommodating as we can be. If we have masks on, we've asked the kids to wear the mask properly. We understand when they go outside, they can take it off, absolutely. We've worked with some kids, if they need to step outside of their classroom and they're alone in the hall, they can do that. I think some of the kids here, I've talked to a few times about it, and usually it's us, hey, just a reminder, put it back on, after lunch reminders. The ones who got issued a 3-hour detention were chronically spoken to and just were blatant about, I'm not doing it. And I respect that everyone has a choice, and what I said to them is we're following our plan, and if you're gonna do it, like everybody else, we're gonna do it right. So that's how that happened.
I think part of the concern is the use of it as a threat versus in those repeated things, and that's what I was hearing in that, as people were talking, was that it was a teacher threat versus this is just a consequence.
I see all of the logs that come through, and I see more cases of a teacher saying, I've asked Johnny or Sally 5 times to put up their mask. If they continue with this, then I'm going to give them a detention. So to get the 3-hour, I'm guessing it's pretty severe.
Yeah, it's repeated. I know there's been people I've caught, hey, this is like the 3rd time in an hour I've seen you. We've got a 3-hour detention I don't want to sign you up for. So I would definitely be guilty of that type of a statement. And I do know we asked the teachers' advisors to please let students know, because we didn't want to issue a
a 3-hour detention. We didn't want to have to consequence kids for this because we really want to be there for education. I got to tell you, this was not on any of our job description. When we started this, I know it wasn't on your map for this. There were things I never thought I'd be doing as an educator, squirting sanitizer on kids in the morning, and hey, can you tuck your nose in? It's a crazy world we're all in. I promise you this, we want to educate kids. We want to stay open and as healthy as possible, and I know there's different people on different sides of that, but no one's trying to target anyone here. We're really not. I think this is a very challenging situation. There's a lot of strong feelings around it, and trying to work with our students. I love these kids. I'm sorry, and thank you for coming, because this is the process they should be involved in, and I'm proud of them for doing that. But I also know that I have other students who come to me with fears too, just like we had other adults coming to me with fears. It is truly, I mean, Jenna, you capped it very well, and I know I'm going off the rail here a little bit. This is hard stuff. I'm sorry, I know, I get on my soapbox. Patrice is reeling me in, but trying.
That's going to bring this to a close. I want to thank everybody that came tonight. Yes, sir?
Patrick, I'm sorry for interrupting, but this actually might be a relevant question because it wasn't addressed. So if you're going back to the old policy, so what does that mean for which schools tomorrow? I guess that was one question. The second question was, I've heard two different things, I just want to get it clarified. I've heard that you go to a masking requirement if you have 3 or more cases, I hear that, and then I've heard you go to a masking requirement if you have more than 3 cases. So I guess those are 2 questions. I'm sorry for interrupting, but...
Normally I would not answer them, but I think in this case that would be good to answer. Brendan, go ahead.
Okay, so you go to a masking, correct me if I'm wrong here, Cassie, if there are 3 or more active cases in a building. Buildings are defined as middle school, high school, and then Richards, which includes the preschool. If there was a scenario where there were only 3 cases and they were all in the preschool, we wouldn't go to full masking at Richards because that's sort of in a separate location. Okay, so based on the board non-vote, tomorrow it would be, unless something happens in the next 10 minutes, middle and high school would be mask optional, elementary would be mask required. I can't guarantee what will happen on Friday.
The high school?
Okay, all right.
The high school?
He said it would be optional for the high school tomorrow.
That's what I mean.
And middle school.
Middle and high. Okay, so we are closing this. I want to thank everybody that came. I want to thank everybody that spoke, regardless of your opinion on the matter. This is really hard, and thank you for participating in this. So, okay. All right, so we are going to move on to guidance in schools presentation.
We love you, counselors. Don't worry. Thank you. I feel better now. Everyone's leaving. It's great. I can breathe again.
I would like to, before you start, thank you. That was really important for us to get through, and so I appreciate your patience. Yes.
So my name is Jenna Brown. I am our school guidance counselor at Richards Elementary School, working with K through 5 students. And I would also just like to thank you. I know that these are really big, really hard decisions, so the fact that you invited me to this meeting and gave us the opportunity to talk and share about the things that we do, that's really important because through the entire school there's only 3 of us. And it kind of tends to be that job role that everyone's like, so what do you do? What does this mean? So this is a really valuable opportunity for us to share the things that we do work on in our schools. So what I wanted to kind of cover and talk about in our time is the curriculum that I use through the K through 5 program. Also talking about some of the bigger programs that we're putting on this year. This is my 2nd year at Richards. So I'm kind of at that point where I'm just starting to be able to be excited and develop new ideas of things that we can do after a year of kind of watching how things went, watching what things worked previously, and then seeing what kind of needs are in place for our kids at our schools. So for this year, our academic curriculum that I'm using is called the Second Steps program. It is a curriculum and a program that I've used in previous school districts that I've been at. I found it really valuable because it covers and discusses topics of hard feelings, difficult emotions, and also it addresses the areas of friendship concerns, building relationships, and talking on the topics of anxiety, stress, and any other social emotional things that it really could cover. The programs are box sets that come with cards for the younger classes and videos for the older classes, and it provides scenarios for the older students, and then we go through a series of questions and discussion as a class of how to address the various areas. And then the younger students right now are really focused in on learning how to be a good student, how to be a good listener, a good learner, having listening ears and watching eyes, and also just building respect in that the way that we learn and do things in our classroom are also really great skills that we use and have when we're socializing with our peers and our friends in the spaces that we're in. So in regards to that, when the time finishes, I have a little extra time in every class. So I also have the privilege of being gifted through different funds the little spot books, and I'm not sure if you're familiar with those. They are fantastic, and they're my favorite. There is a curriculum that goes with that, but we don't use that. But every class, I read one of the books from the series, and they cover sadness, anxiety, anger, happiness, and there's different colors that correlate with the different spots. And then there's also a pack that covers things like compassion, friendship, kindness. Courage was one that I read for a class today. And it has a lot of those big virtue words that we hear and throw around to kids, but it breaks it down in a way that they can understand, and the different books and different series give kids skills and tools that they can use in the moment for coping, which is a goal of mine when working with kids, is to try to do something that, while they might forget it 10 minutes after walking out the door, I'm trying to give them something that they can use in that moment, and hopefully 3 or 4 of the kids that I'm working with will be able to apply it in the next few days and have skills in their toolbox, so when they get to the middle school and the high school, they know how to cope with some of those stronger emotions. And then on the side of the things that I do when I'm not teaching, I work a lot with the social emotional concerns. We have a lot of students facing challenges around anxiety, wondering and learning what anxiety is, how it makes our body feel, how we can respond, so that we don't necessarily be in that moment of having those symptoms where we have to go to the nurse for stomach aches, headaches, and other factors, and recognizing when it starts to bubble up and how to manage it. I also do a lot of work around socialization and building friendships and relationships. The more that we can do at that age level to try to eliminate and decrease the amount of drama or concerns that come up of children being unkind to each other, the better that they'll have the ability to solve some of those problems as they grow older, and also some more skills in their toolbox to find a solution when conflict arises. The other piece of it really is restorative conversations, in that I'm not the one that's giving out discipline and doing things at that bigger level, but I'm talking to kids when something happens, maybe the first time or the second time, or in a friendship scenario where they need that restorative piece. They need someone to talk to them about why it's not a good decision, how can we change that decision, what could we do instead, and working through problems in that sense. And then on the other side, I also work on and do the 504 plans in our district. And for our school-wide initiatives and things that we're doing, we actually just concluded, I believe it was last week, our Fire Safety Week, and we had fire trucks and volunteers come over from Newport Fire Department, and our students were able to look through I think it was 2 fire trucks that came over, and they had 2 firefighters and actually the fire chief that was there for a while answering questions and talking. And they were absolutely fantastic. It was awesome for us to have a positive influence from local community members that help in those situations come and have that fun experience with the kids and talk to them in a good way. And our kids, I feel like, learned a lot. They've been talking about it still as the last few days have gone on. And then upcoming in about 2 weeks, we're doing a Red Ribbon Week campaign, and this is my first time doing Red Ribbon Week, so we're kind of rolling things out very enthusiastically, so I'm hoping that it will go really well. We're looking to incorporate door decorating contests, having local police and fire chief, if possible, or other individuals that our students see in the community come in and judge some of our doors so we can grant winners throughout the classes. We're looking at maybe planting some flowers and doing initiatives in the older classes where they'll do some project-based learning of doing some research and creating posters around why not using drugs is important, making smart, healthy choices is important, and overall supporting the Red Ribbon campaign theme that is in place. And then again, in a few weeks, going into the week of Valentine's Day in February, I started last year doing the Kindness Week, and I'm looking to do that again, where we do different fun themes of outfits every day. We do things to support kindness. We have extra posters we put up, and I'm hoping to grow that event even more this year with other involvement from the community possibly, and even through the students doing things so that it's not just a one and done event. It's something that they've gotten something from and can continue to apply as they move forward in the coming weeks. I think that's all I have on my end, but you're welcome to ask any questions about things that we're doing.
Thank you so much. So, how often are you in the classroom?
I teach in the classrooms at Richards every other week in each classroom. I want to say, is there like 20 to 21 classes? Is that correct?
I believe so, yeah.
Yeah, so every other week.
Every other week?
So about 12-ish. It varies. I have a bi-weekly schedule.
Okay, great.
Yep, and they're 45 minutes apiece when I'm in the class. And then at times when teachers ask for different things, I'll do small groups more focused on student concern outside of that lesson time.
Great, thank you. Anybody else? Russ?
Yeah. So what's as you've done this, what is your take on how the students are reacting and using it, and how are you observing them over the year?
In regards to?
Understanding, using the curriculum that you're teaching them about emotion and about their feelings, and I mean, first of all, I think it's great. I should start there. I think it's great that you're doing that. I think it's really important that, students are being early on aware of their emotions, especially as it's tied to mental health and then as a precursor to mental illness. I think those are great things. I'm just wondering kind of your response, like what you've observed in terms of how the kids are using it and reacting to the curriculum.
Yeah, so this is our first year that we're implementing the Second Step program at Richards. So they've had various curriculums in the past and various systems of doing it.
Yeah.
And last year until the end of the year, I was asked not to do the academic piece, but also we were in COVID shambles of how are we going to make things work. So I don't see a huge impact at this point of what that looks like. However, on my side, because I'm using the language and I'm having the conversations, when kids are coming back to me, I'm able to communicate with them in the terms and the vocabulary that I'm using with the lessons, and they're able to share with me from some of the things we discussed. That's where I feel like the little spot books are fantastic, because one of them was like, there's little like poems and things that go with it, and it's like tracing your hands and you catch your anxieties and you blow it away. So when they come to me, I'm able to have that conversation of, hey, do you remember when we tried this in class? Can we give that a shot and see how it goes? And then once we do that, we can try these other tools. So I think we're really at kind of that starting piece to see what it looks like. I know that in the past the school implemented the open circle plan, and I know there was consistent vocabulary that was used with that, and all of the classes had the same structure in regards, if they were doing it, they were sitting in a circle, they were covering these topics. So I think our biggest challenge as a school really probably is going to be looking to see what we can do to keep a consistency across the board, so that way, if it's me, if it's Mrs. Bergno, any other person that's in our school, we are able to use some of that common language, because we work with all kids in every grade level. So I think that personally, I want to take that on as a challenge of what can I do to ensure that what I'm doing is not just 45 minutes of a box checked in a classroom every week. Is my message being moved on? Am I accurately covering the topics that we need here? I'm not from Newport. I'm not a local resident to this area, and I've only been here for just over a year. So it's possible that the curriculum that I'm using is not the most effective either. Mm-hmm. So it's just kind of seeing what that looks like through this year and if we need to make changes, because I obviously want to make some kind of impact on the kids, and they need it. We have a really big trauma population here.
Yes. So it sounds like there are a couple things that you're planning on doing in terms of communicating with the rest of the teachers. Mm-hmm. Is that, because it sounds like you want it to not just be the one-off every other week, that you want teachers to start using the same vocabulary so that that's reinforced with the kids. What have you done with the teachers, or is it just the teachers being in the 45-minute session with you and the kids?
Yeah, so I actually push in as a special. So a lot of the time the teachers are not present in the classroom. Sometimes they come in and do different things, or they'll hear what we talk about, or I will share the materials of what we've discussed, and I've given them access to come in and look at it whenever they want. But I can say as a school, I know that we've worked and are working alongside Mr. Clark to try to streamline some options of things that we can bring in. And we also have a focus group that's working on this right now of what are we going to do moving forward. It's just, we're kind of in the brainstorming phase of that process, and because I am still newer, I'm not really in that spot to know what has worked in the past, and I'm data collecting a little bit, so you could say. But I know as a school I can see that we're definitely trying to move in that direction. It's just right now we're trying to figure out what will work best to be successful, because we don't want to change what's going on in the classrooms when things are working, and we also don't want to give any more work to the teachers.
Right.
So trying to figure out what's going to work best for them to be successful, but also help in those conversations, while also still supporting administration in their disciplinary actions and conversations that they're having.
Yeah, I mean, that seems like that's a pretty important consistency, and it seems
Yeah.
like it's a way not just to address challenges, but also to maybe prevent some other behavioral issues.
Yeah.
And Patrice knows that this question's coming, but what are your thoughts about how you will assess the effectiveness of this program?
And that's a really great question, and I've been asked that question before in a few different ways of how do you have data to assess and collect to show that your program's working? And I think that's something.
Well, and what data do you choose? Because my guess
Right.
is there's some there already. It's what are you focusing on, and what are you
Right.
going to add, and what are you just going to take?
Yeah, and that's definitely a focus of mine for this year of what I'm trying to figure out in that sense, because like I said, last year was kind of pulling it in, coming to a new job in a COVID year. Don't recommend that because it is really overwhelming, and you are coming into a mess.
Welcome.
But also at the same time, I see that as a really big privilege because you got to see everyone in that moment of like, what are we gonna do and what things stood strong, and those are the things we really need to keep. So I think some of the things that I really want to focus on myself of looking at the data is that behavioral piece of it, and what are we going to do school-wide to be able to pull some of those numbers down. But also looking at the numbers of, and this is more a middle school, high school level, but the numbers of suicidal thoughts and comments and things like that, and what are we seeing that from in children's history, and trying to figure out how we can most support students in that sense, and what kind of trainings I personally need, because I'm very young in my career. I have a lot of stuff to work on, a lot of things to learn, a lot of trainings are out there for me to do things. So I think it's talking with administration to figure out where our bigger challenges are as a school, how I can personally grow to support those challenges. And then on my end, it's really, I just want to focus on behaviors of what we're seeing and what I can do on that baseline, and then also looking at and trying to see which students are seeing me the most often and what are they coming to me for. And that's the biggest thing that I have control over and kind of power to collect the data on and preview, and I've started working on that this year of what grade levels are kids coming to me the most from, what are the reasons they're coming to me the most from, and even just kind of thinking about what parents am I needing to contact the most. Am I having conversations where I have to call out to parents the most in this particular grade level? How can we address that?
Those are great data points,
Yeah.
it sounds like.
Fantastic. Thanks.
Thank you. Take it right now.
Thank you so much.
I do just want to add before Nissa starts, that starting in the classroom was new for Jenna this year. Last year it was not a classroom position. This year, because she does have so many kids that she sees pretty regularly, and also to kind of make sure she was meeting with all of the students, we moved her into the rotation, and having had the chance to observe her now twice, it is fantastic. It is fun to be in, the kids are involved, and it's great.
I have to say, I was really excited when my son came home and told me that you guys didn't sleep. So, you and I will talk later, but I was really excited. I think that is an asset to this district, and thank you for all the work that you're putting in, and your insight into how the kids can grow and that you're still growing is wonderful. So thank you.
Just before they go, I just wanted to say that the beauty of having them here today is not only can the board, but the rest of the community can see what an asset they are to the
Yes.
district, which is why I'm thankful that you guys let them come.
Yep.
Hello. I am Nissa Ridley. I'm the middle school counselor. I am new to the district. I'm also new to the state. So hello. So overall, a lot of what Jenna does overlap with what I do as well. I offer multi-tiered systems of support in 3 major domains. Those domains are career readiness, academics, and social emotional wellness. At tier 1 of those tiers, that is the whole school approach. I really try to focus on the whole school approach because I feel like that's how we're going to get most of the kids. One thing that we have started this year is a token economy, which is part of the positive behavioral intervention systems. And so that basically looks like having kind of like our dollars, our tiger tickets given out for positive behavior in the classroom. And that is something that we are doing school-wide. We also got a parent volunteer to run the school store on Thursdays during lunchtime, which is wonderful so that me and the social worker do not have to run it, and that has freed up our lunch times a little bit. I also collaborate on a lot of teams, such as the leadership team, and then also I attend a lot of the other meetings as well. I also support school-wide initiatives as well. Just like Jenna's doing Red Ribbon Week, we are also doing Red Ribbon Week. We are doing a Spirit Week for it. We're also going to do the photo contest put on by Red Ribbon Campaign. The school could win $1,000 if we win. I'm not sure that we will win, but I really am hopeful for it. More information will go out on that later. We also are planning to participate in the Great Kindness Challenge as well. For Valentine's Day, I would love to do Valentine's. It's been a hit at another school I worked at before. And I kind of think that participating in all those school-wide initiatives really builds the culture of the school and makes it more of a community for all students. I've also implemented a school-wide needs assessment this year. That kind of gives us data on the school climate, and I'm going to redistribute that same needs assessment minus part of it, so just the school-wide climate questions will be redistributed later on in the year so we can collect more data and see what we have improved on, what we haven't improved on, and what we need to focus on for the next year. Also in that needs assessment, there's one question on the relationships. The relationship students have with teachers. So how many teachers in the school do you feel like you have a good relationship with? None, 1, 2, 3, or more. The reason why that question is in there is because I would like to focus on relationships and positive interactions between students and teachers. I don't know if you all are familiar with ACEs in education. Okay, so with ACEs in education, the one thing that counteracts any adverse childhood experience is a positive, stable relationship in that kid's life. That is why I want to bring in those relationships and really bring them out. We also had all of the staff complete their own survey on kids that they feel like they have a good relationship with. We are going to compare that data in November and then figure out who we are missing in there and really target those kids. Right now, I do not do push-in lessons. The reason why I'm not doing push-in lessons is because I'm currently teaching a class on career readiness for all 8th graders for a CTE rotation. That is only for this semester, and next semester I plan to start doing push-in classes based on the needs needed from the needs assessment. So that's tier 1. Tier 2 is just the focusing on some students. So that would be my career exploration class with just 8th graders. Every single 8th grader will have a chance to be in my career exploration class. We do a money game where we get to learn about money and how the real world works. We do different career aptitude tests. And kids just kind of get to learn about who they are and where they fit into the world of work. I'm also going to start forming small groups using the needs assessment data. So students that are willing to be in a small group around some area that they need help with, we're going to hopefully start doing that soon, me and the school social worker. I also have implemented 6th grade community circles this year. My hope is for those community circles to become a tier 1 intervention for all classes. Right now we're just doing 6th grade. Hopefully next year we do 6th and 7th grade, and the year after we do 6th, 7th, and 8th grade. So it becomes school-wide. In those community circles, they just kind of get to know each other. They're about different topics. For Red Ribbon Week, the 6th grade community circle is going to be on a video that is about the Natural High videos. I don't know if you have heard about Natural High, but it is an organization where basically you have these like pro surfers and pro artists and things like that talk about their natural high being that sport. Instead of doing drugs, this is their natural high. I'm also going to be doing a lesson for that for 8th and 7th grade, but for 6th grade that will go out through the community circles I've put into place. Tier 3 is the individualized supports, so that kind of goes along with the 504 coordinator role that I have, and putting those in place and meeting with parents and coordinating those meetings. I also do crisis intervention, and then I also do individual short-term counseling. This year I have met with 98 students so far to provide individual short-term counseling to them. And then last on that list is mediations that I do between students and within friend groups. I also want to say that a lot of my Tier 1 things I would not be able to do without having time to do them. And I'm really grateful for the school social worker that we have, because she takes up a lot of the Tier 2 and Tier 3 jobs that I have and offers similar things. Any questions?
Fantastic. That is a lot. That is, I'm still working my way through. That is tremendous, both of you. And yeah, 98 students. That's a lot.
I'm sure the social worker has pretty much the same number, Joe.
I'm so tempted to ask how many of those are related to wearing masks.
None of them.
Please don't answer that. Don't answer that. I think that's really fantastic. I love the fact that each year they're growing to become Tier 1 supports. I think that's fantastic. One question that I had was about the needs assessment, and in particular the climate questions, and if those would be shared with the board, if not the public, or how that, who's gonna hear about that other than maybe you guys, or how we can tell the community what our goals are for
That's a
climate.
good question, and you know what? I see Brendan trying to raise his hand, so I'm gonna let him take over.
All right.
So my sense would be, as you know, that we said to the middle school, we want you to work on school climate, school culture, those types of things. This is one part of it. So what I would suggest is at the end of the year, you have a group of middle school folks come, including Nissa, including maybe Melissa or Tom or whatever, and then they can give you sort of the full picture. The needs assessment will be part of that, but that way it's not just putting it all on Nissa here.
Right. I absolutely agree with that. Anything else?
So when you talk about school culture, it sounds like relationships is the big thing. What are the other kind of school culture focus or tenets that you're focused on?
So one thing that I kind of like to focus on, but I know we are building school culture this year too, but one thing that I like to focus on is a sense of community. Being kind to other people, being empathetic, being able to understand your classmates and know where they're coming from and be able to put yourself in their shoes. I think that is a huge part of school culture. And I think that just being able to be part of a community can breed kindness within the school. So that's kind of where I come from with how I see the school culture developing.
Thank you. I mean, it's great. I think as a soft skill, empathy is highly underrated. But for any leadership role, people need to be empathetic. And I think I think there's both in community, but then also in kind of taking it out. I think that's important. And I think focusing on the relationships, both for students, because it sounds like you're doing mediation between friend groups, but then also the relationships between teachers or significant adults and students is also really important. My question is, so there seems to be a gap, and I know you said you're going to address it next year, but there seems to be a gap in the students that may say, I don't have someone, and the teachers who say, I do have someone, and where that might be and kind of how you might address it after you kind of are able to target it. How are you going to start building or creating some intentional strategies to make those connections?
So for the kids that have no adults that they feel connected to in the school, what I would like to do, but we haven't completely discussed it yet, what I would like to do is, what my idea is I love that we have the advisory model in the school, and then kids get to have all of this time with this one teacher that they get to have an in-depth relationship with. For the students that have they say no adults that they feel close with, I would love to be like, okay, advisors, I really want you to try to increase your amount of positive interactions with these students. And you know, if the advisor is just like, I really cannot seem to get to this kid, then that would be where me and Miranda, the social worker, can come in and be like, we are going to be those adults for those kids. But as much as I can encourage teachers and other school staff to have those relationships with kids, that's less on my plate to do the tier 3 work and focus on the tier 1 and tier 2 work. So that's my plan right now, but I'm sure me and Tom will talk about it in the near future.
That's great, I didn't mean to.
Yeah, no, you're good.
At the staff meeting in November, okay,
Yeah.
that's when we're gonna have the data for the staff, be able to sit down and say, okay, fine, you know, these students seem to be covered, based on students believe that they can go to somebody when they have a concern, right? But we have these students who do not feel that way, and then we look at the staff data that say, I feel I have a connection with these students. And so there's going to be a gap. So who are we missing? And then we will strategically place, you have this child, you have that child, to begin to try to make sure we're developing the relationships. And then we'll follow up to make sure if it's not working, then maybe that's not the right person, or maybe we'll reach out. You know, I do know some of the people on the list, you know, that say they don't have somebody that they can connect with. I do know in some cases, a lot of them have come to me and have conversations with me about very various things. So in essence, they do have somebody that they can connect with.
Yeah.
But, you know, but we're going to continue to go through and make sure that, you know, by, you know, the second week of November, we're really going after to make sure that we can make a connection. And we can say by the end of the year, hopefully when we do this survey again, we end up saying yes, through the course of the year, everybody says they had somebody that they could connect with.
That's great. I mean, I think, you know, in terms, because the other question I have is about the academic part, but, you know, I think it was Teddy Roosevelt that said, people don't care what you know until they know you care, and this seems like that building of that foundation. And so then the next question that I have is, what is the plan or process? I know you're talking about with the 8th graders doing the career focus, but is there also, as part of that, kind of a prepping them for 9th grade and thinking about tracks and paths to success and how their goals, their professional goals are matching? Is that part of the 8th grade professional focus conversation?
So do you mean to get them ready for high school or to get them ready for careers?
I think it's both, because, I mean, I think hopefully high school is helping them get to the career they want, and hopefully it's just a step on the path. But helping them with the steps in high school to choose the courses that they want that will help them along the way, so that there isn't, you know, what last month we had someone in here, you know, distraught over choosing courses and that, you know, and I think there are a variety of other things. But it seems like that 8th grade is a good time to help kind of with that kind of process.
Yeah, no, I agree. And so in February, I believe in February, we do have a plan for how we're going to get 8th graders signed up for their classes in high school. And that is something that me and then the high school guidance team has talked about and has planned out. I don't know the exact dates of when things are going to be happening, but I know that February is the month that I have in my head right now. Yeah. I think it is going to happen, though. We're going to talk about different classes that they can take and different tracks that they can take, what AP classes there are for them in the future, what their electives are, what different things they can explore within CTE as well. So,
right. So right now we have the
coming up.
CTE rotation. So all 8th graders are in fact doing the CTE rotation. As we get into the spring, we're hoping to do a career fair. So have all careers come in and have students sign up for things that they might be interested in, so they can be exposed to more, saying, oh, I might want to do that. And then that, of course, then leads into the high school with regard to these are the courses you might want to be taking in order to meet that career.
Thanks.
Okay. Yes.
Oh, I'm sorry, Linda.
I just have a comment and then a question.
Yeah, sure.
So I think that for my own experience, had I not made a connection with a teacher, I would have been a casualty. So I think that's really important. And I also know from my own experience with my child going through the district that advisory can be a really important time if you can match them with the right person. That has not been the case in the past, so I hope that that's going to change. because there's often, many times you see kids wandering around out of where they're supposed to be and to the classroom where they want to be. I think that's really important, especially with the statistics we have in this district. And I hope that you guys start really paying special attention to that, because oftentimes it's just, this is where you are and there's no input. I don't think my child ever had an input about what room he was going to be in or who he felt comfortable with, whatever. But I think that's really an important step, especially in your time. My question to you is, and I know this is something from before any of these people were here, but.
Which all means they're off the hook.
And them.
And us.
This is my question to you. How many times a week, or how often, do you four, sit down and actually communicate with each other to build a cross-district?
So the four of us sitting down together, we would like to start doing.
So you're not doing it now?
I sit down with Haley once a week, the high school counselor, because she's also my mentor. And I know I've called Jenna in the past when I need to ask questions about things. So there is open communication. But yes, we should have counselor meetings. That should be more regular and more frequent.
So I feel really strongly about that, sitting on the board here, because it was a conversation we started many years ago, Patrice, when we talked about.
You just said I wasn't part of it.
Well, you were the closest one to abuse with this. But we talked about the transition from elementary and having there be that influx where, these important roles are really building off each other instead of, working in unison versus in solace here, so.
I do think there's an opportunity for that as well with our PD days.
Yeah.
I think that is a good time that would allow everyone to be free. The schedules in amongst themselves are crazy in each building, so finding a common time each week, I think, might be difficult. But, definitely trying to figure out how we could do something monthly even, or on our PD days would be, I think, a really good benefit.
Yeah, I don't think that's enough. But I think with technology nowadays.
Sorry.
With technology nowadays, the three of them could sit down for 15 minutes on a Zoom once a week just to kind of, hey, do you have any problems? What are you thinking? I was thinking about doing this. What do you think? Can we blend it with yours? I mean, just that 15 minutes a week, Zooming with one another in a time that's equal for all of them, I think it would give great support for them and move the district forward in a more positive light, because I think the less time that these people are working together in this important role, the longer it's going to take to make the accomplishments each one of them want to make. And it sounds like they're all doing kind of sort of a similar thing, but it sounds like they could also really benefit from that just small piece of time a week.
I think that's a great point. Okay, thank you. I'm sorry, it's not an actionable item, so we can't take, I know.
It wasn't a question, it was a comment.
All right, thank you so much, Tess, I appreciate it.
But I'm not knocking you guys, I'm trying to help you guys. I'm telling them that they should be doing that.
Is there a way to get my chart on the screen? If not, that's okay.
I did share it, but we have printed copies too.
If you know me, I'm a chart person, so.
I love it.
Share it with you
Thank
too
you.
if you want.
He's listening.
Do you want to just take that? So I'm Haley Sharp. If you don't know me, I'm one of the two high school counselors. I'm also the school counseling department head at the high school. Molly Smith is our other counselor who cannot be here tonight. So on the chart, and for those who are at home and can't see it, what I did was kind of broke it down by what areas we work on and what levels we do each of those on. So the columns are academic, social and emotional, and then career and college readiness. And then for each of those, we work with individual students, and on that individual level, we work in small groups, and then we also do things that are universal or school-wide or even just like grade-wide. High school is a little different than the middle school and elementary. We, right now, are focused a lot on the individual students.
because that's where the need is right now, and those are kind of the higher priority things that need to happen first. And we get to the small groups and universal things as we can. I would love to do more. So if you look at it, individual student things, that includes anything from meeting with an individual kid to, you know, contacting the parent, working with another staff member on like, hey, what's going on with this kid? How can we help? Working with outside agencies like West Central Behavioral Health, our JPPO. Well, we now have an SAP in the building, but she's technically an outside agency. So all of those kind of things where we're focusing on individual students and what's going on with them. For academic stuff, we do all of the course planning and like, hey, what do you want to do after high school and how do we make that happen for you while you're in high school? So that's the, what classes do you need to take to do this career? Those kind of conversations. All of the scheduling in the spring. We help support and monitor students, making sure they're meeting graduation requirements because you can't go have the dream career you want if you're not getting out of high school. This includes things like every quarter we send home letters to seniors and their parents on, are you on track to graduate or are you not on track and what do you have to do and how can we help you? We help support students in figuring out what it is they want to do after high school. So that kind of spans across all three columns a little bit. Things get a little messy. For underclassmen, we also help track how many credits they've earned. Now that we have the new grade progression requirement and you have to earn a certain number of credits to move up a grade level. So we're keeping track of that and notifying students if they're not going to make it and help them kind of turn that ship around and how do we get them back on the right track. Or if this is not the right place for them, what are their alternative options like HiSET or you know, adult ed and night classes or online school, because we're not the only option and we don't fit everyone. For the academic and social emotional, we're a part of a few different teams and meetings. So there's the educational support teams, which is kind of not a step down, but similar to a 504, but we can do it for any student. They don't have to have a diagnosis. We look at what are their strengths, what are the concerns, and what actions can we put in place right now to see if they work, and then we follow up in 4 to 6 weeks, get the team back together, figure out what's working, what's not, what do we need to change. 504 plans, those also come along with like regular check-ins with certain students where that's part of their plan. I talked about the alternative learning plans. We are part of IEP team meetings, so we're there to help discuss kind of a wide range of things and give our input and talk about what their plan is through high school and afterwards. We are part of the weekly student support team meetings where it's us, admin, school nurse, student support specialist, I think is Haley Katrupi's title, SAP, psychologist, special ed coordinator. We all sit down weekly and go through. Well, first we have a referral form for teachers and parents and anybody to fill out saying, hey, I'm concerned about this kid because. So we'll go through any new referrals and talk about, we kind of filter. So like, is this a medical issue that we need to bring to the school nurse? Is this a academic issue that we need to maybe talk to the kid's case manager? What's going on? So we filter those concerns and then we do regular follow-up on each of the kids that we have on our list. We also help admin and consult with them on kids who are struggling with attendance or behavior problems. I know sometimes, like today, I met with Sean, who's over there, and he just went through his list of, hey, these are my kids who are like chronically absent right now. Do you know what's going on? And we just consult because sometimes I have information that might explain what's going on, and sometimes I don't. And then we move forward with that. For social and emotional, we do short-term counseling, so like coping skills, solving problems, dealing with peers, kind of anything under the sun, pretty much. So far this year, we have seen over 300 kids in our counseling office, so in about a month, and those are just the ones who remembered to sign in. That can range anywhere from, hey, I hate this class, I want to drop it, to having really severe problems at home that they're trying to work through. So it's a wide variety of things that we're helping them with. We help and refer to outside resources when it's something that might be longer term. So we work very closely with West Central Behavioral Health for students who need counseling. We deal with crisis response, so if there's any safety concerns about a student harming themselves or harming others, we deal with those situations. We help with re-entry meetings for students who have been out for an extended period of time, no matter what the reason is. Also at the individual level for career and college readiness, we work with our upperclassmen on, how to apply to college if that's what they want to do. If it's not college, what job do you want and how do you get it? Is there a training program? Can you just apply right out of high school? How do you fill out a job application? All those kinds of things. We use SCORE, which is an online platform where they can search for different colleges. And that's also how we send out their transcripts and letters of recommendation and everything when it's time. In SCORE, there's a link to what's called U Science, YOU Science, which has the career interest inventories and the different inventories that help match them with what careers might fit them best. We haven't gotten that out as widely as we would like to. Right now, it's more of like an individual student thing, but with more time and support, I would love to make it a school-wide thing. We help support students with their post-secondary readiness pathway requirement, so scholars, CTE, or workplace education. So we help students figure out which one they would like to do or try, and then how to get them there, including, if it's an internship, we help them with the paperwork, and then sometimes hand them off to Jennifer and go from there and help monitor that. So I know I've been talking a while. Those are the individual student things that we spend the majority of our time on. I will note the things in red and italics are things that we would love to do. We just don't have the time in the day. Any questions?
Yeah, you go ahead, Linda.
I have a ton of them, so if somebody else wants to go first.
No, go ahead.
Oh, okay.
If you have a ton of them, it'll probably answer.
I do have a ton of them. You guys haven't entered high school yet.
No.
First year, so that's why I questioned.
So I just want to say off the bat that, Haley knows that I think that she does a wonderful job. So that, I just want to put that out there first. But as a board member, my personal opinion, this is just too much for two people to do. I'm sorry. It's ridiculous. I have been in this seat for over 13 years now, and I have dealt with these counselors, all the various counselors, and we actually joked with Haley saying 5 years, she's a vet here. Our kids are dealing with crisis intervention at a rate that is so much higher than most districts. I don't know about the other two, but I'm going to guess that they are doing crisis intervention probably 3/4 of their time. And I know from talks with you and other people in the past, you can't get to all the kids and do the things you want because you're putting out too many fires. I have sat on this board during budget seasons and said, we need somebody in these districts that's doing social emotional crisis intervention, something, because they're not doing the things that I believe a guidance person should be doing. I think they're doing a lot of other jobs. Personal opinion, statement, but I think that we really need to find a way to better help these kids. And people don't understand what crisis intervention really means. And it can be anything from problems at homes to their own problems to abuse, homelessness, tons of different things that these kids are dealing with. If you can't deal with social, emotional, you might just throw out the curriculum, because if you can't deal with that first, they're not going to come in to learn. Not when they're too busy worrying about real life crisis for themselves. Again, another statement. I think that's really important that we have to look at that, especially with this budget season coming up. I think she said something really super important too, is the score, the aptitude test. We should be doing that in 9th grade. They should be doing it every year, these kids. Half these kids I know from elementary school, way back when I was just volunteering reading in the classrooms, a lot of these kids don't even have hopes and dreams in the elementary. They don't know that there's something better out there. They don't even know education's their pathway to success. So having something that a kid can grasp onto earlier than later, and just giving a couple kids something like an aptitude. Are they going to be good in the CTE center? What can they do? Hey, Haley, I got this score. It says, gee, I should do this. I never thought about doing this. Nobody ever said it to me. Is there something I can do to get there? To me, that's what a real guidance counselor's for. She also touched on another subject that's really kind of sore for me, is that they're doing a lot of stuff with IEPs. Do you get people realize out there how many IEPs and 504s we have in this district? I mean, for them just to go to that meeting, that's another 3/4 of their time. How the heck are they doing their jobs? And then on top of it, they're trying to teach these kids where they can go to get to where they want to be. Well, how about all those kids in the 504s, IEPs? What happens to them when they age out? And I know that from my own kid who needs support and is at a university now. There are plenty of programs out there for kids that are autistic or have severe ADHD, also mental illness, I mean, you name it. But they don't even have time to research what those places are. And for my own child, it took me 4 years to research multiple places and the different types of programs and what it means. People in this community that have kids with IEPs and 504s, I've been like, gee, you should look at this place because it's not right for my kid, but it sounds great for your kid. I feel like we're missing some of the boat here. And the more that we keep planting on our, and this goes for you guys too, I mean, you know, you gotta call a duck, right? We are poorly financed. We don't, it's not really the community's fault. It's not the taxpayers' fault. The inadequate funding for education hurts places like us where we have a low base. And we have really great people here that are trying to do good things. They just can't possibly do it. So at some point, instead of just having presentations like this, we'll need to really sit as a board and say, and with the administration say, how important is this? Is this going to make a big difference for me? Social emotional connection is going to make a huge difference for every teacher in this district. How do we better support that? What is it? Do we unite with any one of these behavioral health places? I mean, they're overworked too, but there's got to be something that we can do so that they can focus their guidance on actually what I perceive guidance to be. Maybe I'm totally off the book, but, and I know that you've heard me say this many times. We've had this discussion back when you were just a youngin'.
Yep.
5 years ago.
Yeah, 5 years ago, yes.
But honestly, the people, the predecessors, and I mean, it's a domino effect. How many times do we have to do it? Ms. Healy gets stuck with it too. If they can't do it, she's getting called in. I mean, it's just layers and layers. I mean, we really have to take a look at the demographics of our students and say, you know, is this something that's really needed? So,
I mean, if you just look at what's here in red, which you said
It's crazy.
is stuff that you want to do but you can't. So I know they can't see it, but I can, so I'm gonna read some of them out.
Yep.
Career Day, field trips to local colleges and businesses, social emotional learning curriculum in classes and small groups for targeted topics such as bullying, grief, anxiety and stress, executive functioning, reviewing test scores with students and parents, and small group to review study skills and test taking tips. I mean, all of that, this whole
Don't
time.
forget the score that she wants to do with everybody. She doesn't have that in red, but she
Yeah,
should.
sorry. I'll change that.
But this whole time, for all three of you, what's been coming back to my mind is back in April when we were talking about how we define success in Newport. I think this speaks to that, of the fact that we have, I think it sounds like a fantastic team, but where we're lacking too. And so I just wanted people to know what was in red on this, because I think that's important for as much as you do.
Yeah, and I think it's important too, Jenna, you're 100% right, because we love to get great reports when people come up here, but we also want to know the bad stuff too, because we can't change it if we don't know it.
Yep.
And, you know, we're here to support you guys, and we put our trust into Mr. Minahan to really be the leader to help us with that. And if this is something that's important, and to me, I feel like it is, because I've sat here too long and listened to the same thing. So when is it ever going to change? And when I think about change, and if I go into a business, I never say, oh, well, we got to, you know, gee, this is a lot to do. My question always is, what do we have to do to make it work? And then backtrack from there. What do we have to do to make these things priority? And then let's find the solution.
Russ, did you have anything?
Yeah, so you have first-year seminar, is that part of?
So the first year seminar is a pilot program that our teachers are teaching.
Okay.
So it filled in their schedule.
But that's a way to support the guidance, because it sounded like maybe SCORE was done in that.
I have hopes of it.
Well, my son reported that he did it, and he said, Dad, you should try this
Okay.
just to see if you
Okay.
had a, see if you're in the right job.
Molly Smith was on that. Molly Smith was on that
Yeah.
particular committee. I was working on the work habits. So I'm glad to hear that it made it in.
So, but I think that that's part of that advisory of getting your, you know, the goal of, at least for the first year, the ninth graders, to do that. It also seems like advisory, that time period, that, like, how can you measure what is a good number? You know, it sounds like, at least in my case, there's basically, if we divide the time out, there's 2 minutes per kid. That's not a whole lot of time to have an advisory conversation, and it becomes a triage of which kids need it the most and which ones would be fine to float along. And I would prefer not to have that happen, because it would be nice to have all of the kids be able to excel at whatever level or rate that they can excel at. So I'm concerned about that advisory ratio, the time. What are your thoughts about how, like, what's your plan with that?
I know specifically for the freshman advisory right now, we are looking at redistributing advisors from the sophomore and junior classes where they're lower numbers, because the freshman advisories are way too big, especially with freshmen who need a lot of hand-holding sometimes. So we are working on that.
Yeah, I mean, I think I think it's important. And I think last year you brought kind of a curriculum for that advisory, is that right? Kind of each year?
So the teachers worked on I'll chime in and help out here. So the teachers actually formed a PLC specific to advisory, and it's not a curriculum yet, it's essentially a framework. There's much more work to do. In it, it does detail goals on, you know, what an advisor should offer and work towards with their students. Our goal is to have our numbers for advisory between 10 and 12 kids. Right now with the freshmen, we have an average of 18. I was going to say, okay, 17 to 18, which is much larger than we anticipated, partly because we had students who joined right at the start of school year, so our numbers got a little larger than we had originally planned. That makes it very challenging. 18 students is really too many. I'll be frank, if we didn't have the CTE here, you would not be able to support an advisory program, period, with it's a skeleton crew in your high school. So
My concern is that then it sets all of the first years up for a challenging 4 years
Yeah.
and then going beyond. So I'm really concerned about that. But I also think that leads to kind of Linda's point about, well, how do we get the support that we need? And it sounds like at least one of the strategies is to have the teacher support. So similar to your plan at Richards, it's disseminating, but there still needs to be kind of more constant communication and a clarification. I'm just concerned.
Yeah.
And again, I know it's not through any lack of effort. It's actually through a lack of manpower, human power.
Yeah, yep.
I think it's a pretty real thing. And then the other part of that, and I think, Linda, this is what you're saying too, when you say, so how do we make this happen, is thinking about, what's the evidence that you use to justify asking for more help? And so it seems like we really are in a kind of a crisis management in the whole district, but thinking about, how many of those counseling sessions are you having? How do we work, what's the strategy to reduce that number or at least make them less severe? How many of the IEPs are we having and how far out are we scheduling them? Are we scheduling IEPs out 6 months or are we able to kind of get them right around the beginning of the school year, right? So I think some of those data points might be helpful in terms of justifying for why we need another person or how we need to maybe restructure the model or however it is, but and again, please don't hear this as criticism.
So my challenge right now is figuring out what data is gonna be the most important to collect and how best to collect it, so.
And what's meaningful to
Yep.
tell the story about what is happening to help students make decisions about, and their parents, because it's, at least for the 9th and 10th graders, I think parents are still a bit more involved. But to be able to kind of educate us along the way to help them make the best decisions. So please don't hear this as a criticism of what you're doing.
No.
It is absolutely how can we make this better?
I'm asking for help because there's a lot more that I want to do that I don't have time in the day to do. So I appreciate all of your comments.
one real quick data thing that Haley did say, but I just want to make sure you did hear it. And I think the more we can gather that information to review will be helpful for all of us. But in the first 29 days of school, they have seen, and these are the documented, so not the quick, I'm running into the office, I need this paper, I have a quick question. These are kids, our counselors have seen 310 students in 29 days. So.
And last year, we had 929 that signed into the office. And that is, I'm missing some data for, I think Cassie had to take the contact tracing sheets.
That's how we happen to have it, was our,
I'm gonna blame you.
who was there.
But also 20% of our population, a majority of our high needs population was remote last year. So we're already at a third of last year in the first month of school.
I'm just gonna ask you because you're the senior here, but honestly, without looking at them, looking at me, what would be the one thing that would, if there was anything taken off your plate in your job, so-called job description, or the things you're doing, I should say?
Yep.
What would it be?
I think I see two options. Option one is hiring somebody to do just college and career readiness. So basically take this whole right row or column and have that be one job. And I think they could even span into the middle school and help do more of the career and high school preparation stuff. And in the CTE, help with those workplace education jobs, spots. So that's one option that I think would work really well, because that would free up a lot of time for us to focus on the academic and the social emotional, which is kind of where we're lacking in the small group and universal. The other option which I don't know if we'd ever find somebody who would actually take this job, but someone to manage 504s and all of our standardized testing, because that stuff takes up a large chunk of our time.
I think that depends on how much we're willing to pay someone to do that.
Yes. I don't know if we'd be able to pay enough.
Right. Well, when I look at the college career readiness idea, I mean, I see them all shaking their heads over there in agreement. That seems like it's almost like a course in CTE, you know, that would do that.
It does seem like that would be a way
Doesn't
to
it?
kind of,
It'd be like a prerequisite right in eighth
Yeah.
grade. They go into it, kind of do it. I mean, I'm not an
So-
educator, but
I would argue against that because I think these jobs need to happen throughout the 4 years, not in one course, and it needs to be able to be on that individual level as needed, especially in
Yeah.
senior year. Like, hey, let me sit down with you and go through the Common App, which I don't always have time to do with a kid, or let me sit down and walk you through financial aid and what that means.
but it sounds like
and
maybe
the
you
day-long
could.
process it is to fill it out.
Yeah.
Yes.
Maybe
Yep.
it's something that's somewhere in between where they teach a couple classes and the other part of the day they're doing that type of a thing.
Yeah, I,
Chime in
Yeah.
to support Haley on this. So I think it's also really important for the school board and the district to know how much together we try to support this. So CTE teachers and high school teachers are also trying to support that next step for students in different ways. So we do provide, in the CT, but it happens in the high school too, we provide those bridge to college, the college connections, the internship opportunities. But the honest truth is, there's not enough time. Like we discussed, I can probably handle about 12 interns, and I need 3 to 4 week lead times, and honestly, there's no guarantee, because if a kid wants a Master of Art and I can't find that, then it comes back to that conversation about where are we? So it has to remain flexible. But we want to boost that even more. We want students to feel like they know where they're going after graduation, and you have these classes that really, they need individualized mentoring support. So I offer that, Shannon offers that, Haley offers that, our teachers offer that. But the reason I'm nodding, because Shannon and I talk a lot about this, there becomes a limit to which you can offer the type of support the students need, and that's where that college and career readiness, it gives them so much faith that when they leave high school, they're ready and they have a plan, and that helps parents too. I mean, I met with families this summer about college counseling, about the FAFSA, not because I'm an expert, but just to help take the load off and give a family who is busy, an opportunity to talk about those things. So I just want you to know that we absolutely are asking our teachers, we are working as administrators to support kids individually and support the counseling. But I'm the first to say that we can't meet those targets the way we should.
I will also say, sorry, Shannon. Like you were saying, Linda, we have a very high risk, high need population, and that's not just social emotionally. We have a lot of students who don't have any other family members who have ever gone to college or even a community college. So they need more support than I think other surrounding schools students might need. So it really is that individual time, especially when they're juniors and seniors. I think, 8th grade, 9th grade, doing the classes about like what jobs are out there, because again, we're in a small town, they don't know what jobs exist even, and it might be something that they're totally interested in and gonna be really good at, but they just don't know that it exists. So more of that career exploration.
Important too, because they don't even know what they're good at.
Yep.
Sometimes it is just planting the seed.
Yeah.
The concern that I have, so Jennifer, my concern is it's ad hoc. Like it's that the students have to reach out. So the students that don't know to reach, that they don't know what they don't know. And so I appreciate and I value how much you all reach out to students but my concern is that it's the ones that are gonna get lost. Or the ones that are quiet, or the ones that are no problem that we don't reach. And so I think those are my concerns.
Or the ones that could go off to Dartmouth that don't have a family member that's pushing them in that direction, you know what I mean?
I do. I mean, that's at Chloe Sawyer, that's been a big challenge, is how do we help and onboard students who have their first generation college students, and how do we kind of support that in a way that they're not supported?
True. And I just know from, having my child at the first year of university, I mean, competencies and things are really terrific as far as teaching goes, but they almost also need to understand what to expect when they go to college.
Yes.
And the demand on the kids when they go to college, like, it's pretty typical to stay up till 12 or 1 doing homework. I mean, that's the real life of it. There's no leeway where in high school the teacher says, oh, okay, you can get it to me later, Johnny. In college, they're like, if you don't get it to me, you get a 0. And
they don't ask for it.
And you're late to
That's
class.
the due date, and it's just turned in.
Yeah. What happens when you're late to class every day? Is there is there an effect on that teacher's relationship with? I mean, the kids just don't know those basic things. And those are part of the steps of success, post graduation, that we're not really there yet, and we don't have the time to do yet.
Shannon, did you want to say something?
I really just wanted to say that really what Russ said resonates with me a lot. We know our students are heavily relationship-based.
Yeah.
And to have equity, it's really, for me, it's about our adults having time just connecting with our kids. So I think part of what I hope you hear Haley saying is she wants more time connecting with kids. If you wanted students to have equal access to all these things, freeing them for that reason as a counselor in a building is powerful. Giving our teachers more time as advisors is powerful. Letting them know that these are options for kids. When they do sit with us, they're like, oh, great, now what? So we finally have a structure that supports kids being creative. Jennifer and I will not be able to sustain that the whole time. I want to be clear about that. As we move forward with Pathways, they need support. They haven't done, like we talked a lot about college, but they don't even always know, how do I reach out to another adult if I want to intern at a business? How do I do that? They have no concept. I reached out to Patrice not that long ago about, a student coming and working with some of the kids in the elementary school. Because the kid goes, well, who do I call? I'm like, well, you could start with the principal, but they don't have that process in place. And I think the more we can, that's a strength. Relationships are strengths, right? And if we play off of that knowledge and do what we can to ease our staff so they can focus on relationships, we can make sure every kid has those opportunities.
Well, and I think the kids have the time. I mean, looking at the number of learning labs that they have, the kids have the time.
Yes.
So I think part of this is this year, I know in the past few years it's been triage of facilities, but I think this year for the high school especially, we need to figure out how to get more teachers in the building.
So I kind of hear that everybody is in agreement with this, so I would challenge the administrators, since it is budget season, to seriously consider what we're talking about here and to bring something forward to us.
We have no problem adding things.
Well, but
It's
Brendan
gotta
is
be
justifying it
justified.
too,
It's
to
gotta
being
be-
able to say, this is why we really need this.
So if you remember though, what was it, 2 short years ago?
Yes.
I do.
The high school lost 4 teachers.
I do.
Of course that's gonna have an impact.
Sure.
And so there's a stability issue too, though. So now we go, we make the case, we put them in, and then next year, they're down 4 teachers. There's part of a relationship, and what I've heard the kids say is that my people come and then they leave.
Yeah.
And so, if you
Yeah.
don't, if you're trying to always triage things, so to speak, you're not getting that long-term success that we're looking for. I've had so many jokes that I was gonna say about Haley being like totally comfortable, there's only 2 people, they got this, but they clearly need help.
Yeah.
And we'll bring forward that they need help. That's what we can do, and we can make the case, but the vote is the vote is the vote, and
Well, I think part of the case too is reporting those 4 years, what that's done and what we've given up and what our,
Absolutely.
and more importantly, what our students might be, where their shortfalls are. Because I think that's, you know, it's part of the justification, because it's not just, this is the budget and this is, you know, because that's a huge number. But if we can talk about what are the consequences that we've seen because of these people missing, and these people cost money, because in our country, that's how we demonstrate that people, you know, that's how we compensate people. That's how we show worth. I know I'm preaching to the choir.
no, yeah, I was gonna see if we
I-
were gonna come up with like, we're gonna start giving them eggs and
But I also think
chickens
that it might be.
as compensation.
Like, because of your point about the yo-yoing.
Yeah.
We can't do that.
Well, it's not a good long-term strategy.
No.
And I think, you know, I think we've, as a district, you all have made some inroads in terms of retention. We've seen less kind of
Yeah.
loss. And I know some of that is COVID, but I think some of it is a change in kind of how things are managed. And so maybe some sort of stepwise plan of, we need, you know, one more guidance and maybe a faculty member to teach
Right.
some courses. I don't know.
Thank you.
Thanks,
Thank you all.
Haley.
Thank you.
Thank you.
All for staying. I really appreciate that. Okay, Dr. Manahan, CARES ESSER 3.
CARES ESSER 3, this is super short. I just wanted to let everyone know that there is a third one. It's about $4.25 million. It's okay, I won't take it personally. So it's about 4.25 million. We are still trying to figure out the parameters around it. We would like to use 2.5 million of it towards the CTE renovation and have it count as our 25%, as a portion of the 25%. We are still unsure whether that's going to be allowed or not. There's also some language in the expectations that seem only applicable to New Hampshire, but that's a different story, about what they're calling meaningful consultation. And we're still working through that part. And so that was, I just wanted to give a heads up that we're still working through it. It's a 3-year grant. I know there are folks who have ideas of things that we would like to do. Ms. Ferrigno is one of them, and it's a great idea. It is, it really is. And there should be funds available for it. However, until you cross step A, B, C, D, E through Z, you can't really get access to it. So that's the CARES ESSER 3 update.
Yeah,
Sure.
and that goes right with, I sent Jenna and Brendan the article about how schools are doing just what we want to do. It was a big,
Oh,
huge article
yeah,
about it.
Yeah, there was, it's
So,
about all the sports stadiums
if we can
they're
do some of that
building.
stuff would be,
Because they're using the flexibility that of supplementing, not supplanting, not being a thing.
yeah, don't say that.
Well, they are in such that they're saying, well, we're just using what we raised in taxes to build this new stadium.
Right.
And then we're gonna use this other money for A, B, and C. We
That-
can't do
that
that yet.
works. We
But
can
it doesn't work currently in this state.
Okay, anything else on ESSER 3? Okay,
Thank you.
John, you are up.
Oh, yeah.
Thank you.
Bugging me all night.
You should have seen me last meeting. I was flailing around because of the
I thought the
flies.
black flies were gone.
Okay, John,
Hello,
hello.
NCTV here. As far as sports are concerned, we have got live feeds to all the fields, all the way down to the soccer field. We're hoping that baseball will be coming to this campus. NCTV has put over $5,000 into this, as well as countless hours of trying to get people to film and doing all the editing of all of the broadcasts that we're doing, as well as prepping and setting up. We need students to get involved doing camera work. I think the time has come for us to stop saying, well, whoever shows up, and maybe it's going to be a parent who shows up for a football game. I think that we've reached a point where we need to start putting it as a part of the curriculum, so that the kids who are on the field but not playing, let's say you've got two teams going, one is on the field and the other one's waiting for their game next, that if all of the kids learned how to operate the camera, and this is what you do: you open the door, it turns on, you press the record button, you're there. All you need to do is move the camera around on the tripod at that point. So any away games, any games that we're doing that are that we're doing live, but we can get them set up so that it's just easy to be able to operate the camera, would be a benefit to everyone in town, because there are a lot of people who watch these games. We're now on Facebook and on YouTube, and we're getting a lot of hits. And people really appreciate this, and it's really a game changer for the type of people that are starting to tune into NCTV and recognize that it's really a part of our communication in the town. So I don't want to falter at this point. So I'm not really sure how to go about this. I have tried to work with Jeff Miller about it, but he's not being as pushy as I would like. He's suggesting some parents and maybe the coach and maybe this, but they're not coming forward and doing it. And we need to insist. We need to say, hey kids, here's part of your learning. I mean, you get a water boy. You've got kids that are doing other things that are involved in the sport that aren't just playing the game. This should be part of that. It's not a big deal. It's not a heavy involvement, and yet it is a big result. There's a huge result. So I'm appealing to the board to help me find a way to push this thing forward and get it going. We're probably not going to get it done by the end of soccer, but if we can get things happening by the spring, in order to tape baseball, we've never recorded baseball. If we're going to do baseball, we're going to need 2 cameras. I mean, do you follow the runner or do you follow the ball? We're going to need both. The field hockey's going live, but it's me or it's Susan who's out there, and I'm not paid to do it. The football games, I'm going to be there Saturday, but there's 2 soccer games and a football game on this Saturday. So that means we've got 2 people that have to be out there filming these things and making sure that it's covered. And this is a big football game. We're on the opposite side of the field. I'm going to need somebody at halftime to go on the other side of the field to be able to do the band and be able to record the halftime game. So this is a big issue, and I would like to have to get the school involved as much as possible. Make it a Tiger Pride thing. We've offered money, and kids aren't going for it for money. Parents aren't going for it. I tried to get bus drivers and said, look, you're going to be there anyway. You want to earn a little money and just sit there and move the camera? Nobody's doing that either. They don't. Maybe they don't know how easy it is. Maybe it's just don't care. Don't know. But we need this to happen, and I would really appreciate if we can get the administration and the school board behind this to move it forward. Thank you. Any questions?
No, I have a comment, though. It seems like, and Shannon, you might have to correct me, but it seems like it might be an easy opportunity to put something like this in the weekly newsletter for signups for community service hours for the kids. Just an idea.
Yeah, we have.
Yeah, it's already there.
John's not kidding. We've done a lot of asking, offering community service. I didn't know about the money. That's a different level I didn't know about. But it has been difficult to find people willing to take on that task. I don't know the reason. I will say this, I hear from a lot of people that they love it, that they love accessing it on Facebook or NCTV directly.
Yeah.
I've watched it. It's actually really awesome. I really like it when somebody tells me to score partway through though. That's helpful.
Yeah, that's hard to do, but
And you guys are
we're
actually
working on
rocking
that.
it, that they're trying to get it in there periodically so you know where things are at. So you can't always hear well. But the community's coming out for this, whether it's remotely or in person. And so I agree, if we can support it in some way, I would love to. I do know some of our teams have like 0 subs. And so for people on the sidelines, that's not always an option.
No.
Some do.
But they've got a parent or a friend there.
Yeah. Yeah.
Something,
So,
you know.
Yeah.
And we've actually offered a gift to the friends of the athletic department or to the booster club and said, look, if you can do this for Tiger Pride and get involved, NCTV will put some money into your equipment or something like that. And that's not working either.
Seems like maybe we
It needs to
could like put it in when the kids have to go sign up for sports, like something that they could be told to parents, because, I mean, not everybody looks at the newsletter, let's just face it.
Thank you, Linda.
I do.
I mean, I do, but, you
We're trying
know,
to work on our sound bites, but I know we're also limited on what we can sound bite
Yeah.
out on Facebook, and not everyone's on Facebook, so
yeah, it's tough.
it's been tough in general getting people to volunteer for different things. I know we had a couple of groups I'm gonna talk about later tonight that we're trying to get volunteers for. I'm happy to help, at least.
Let's
start
do a
with-
sign up during deliberative.
Well, I
Let me
think
know how
the
that
other
works out
sign-up
for you.
would be next Thursday at the expo.
At the expo, we'll put a.
Yeah, that's not a bad idea.
Absolutely, we can put that there.
And maybe
It
do
would
it
be
by
so great.
sport too, John, so you've got some
Yeah.
contact by.
By the different events,
Yeah.
and, you know, sign up for one game, that's a start. Sign
Yeah.
up for your favorite sport, or just the seniors, varsity or junior or whatever. You know, we're not even getting into middle
I
school.
kind of feel
here.
like they do it for pizza or something, right?
Okay, anyway, thank you very
We will
much.
keep thinking about it, John, but thank you. I
And
appreciate it.
Thanks, John.
Thank you for all the.
Yes. Okay, policy, first reads.
Okay.
Go.
We have BBB, school board elections, BBBC, board member or district officer resignation, BBE, vaccines and unexpired term fulfillment.
Vacancies.
Huh?
Vacancies, not vaccines.
Sorry.
It's okay, no worries.
Oh, now I can see. BEC, non-public sessions, BEDG, meeting minutes, GBCD, background investigation and criminal history records check, GBI, staff participation in political activities.
Is there a second?
Second.
All those in favor?
Aye.
Aye.
Second reads, EBCA, crisis prevention and emergency response plans, ECAF, audio and video surveillance on school buses, EEA, student transportation services, EEAA, video and audio surveillance on school buses, EHAB, establishment of bus routes, EEAE, school bus safety program, EEAEA, mandatory drug and alcohol testing school bus drivers and contracted carriers, EEAG, use of private vehicles to transport students.
Is there a second?
Second.
All those in favor?
Aye.
Aye. Very good. Communication, who would like to start?
I will go, because I'm going to set the expectation to be short and prompt one time, okay? Just gonna set it out there. So things are going great at Richards. We had fire safety week last week, as Ms. Brown talked about. Kids loved it. They also loved bus evacuation this week. Who knew bus evacuation was so exciting? But they got to get on the bus. Some of the kids who have never been on a bus, and then they sat down, they jumped out of a bus. We talked about how to move away from buses. Very exciting and wonderful things. The big news for us at Richards School is we are going to be doing the Halloween parade. And that will be on September 29th at 1:30. We will be sending out information to families tomorrow, but we will use our traditional route to go downtown and around the common and back up. We are unfortunately not able to invite families into the building at this time to help kids get dressed and or to celebrate afterward, but we are encouraging families to join us along the parade route and cheer us on. We had talked about the possibility of families coming into the building, and it would put over 1,000 people in our building, and that's just not okay. So we are just going to look forward to seeing families throughout town, and excited there. And besides that, we're just working away. We had a great PD day looking at data. We had a math data team who put together some fall benchmark data for our math. So now both our math and our ELA have 3 points that we check on throughout the year, and kind of are using that to measure our success and where we need to go instructionally. So it was a great day of data conversations, and looking forward to seeing, what adjustments we make and how that helps impact the classrooms. Time.
Pre-K going to be part of the Halloween parade today?
Yes, they are. Okay. They haven't been told this yet because no one's been told officially yet.
Oh,
But
okay.
tomorrow they're going to find out.
Even just for part of it.
Oh, yes. So I
know it's a long
I think
route
for
little
pre-K, they might want to join us
Right.
down at one corner and go around the common
Yeah.
because they got little legs and their little
legs, I get it.
costumes. So.
I get it.
But yeah.
Thank you.
That's my favorite event.
2 minutes, 9 seconds. Go.
Darn it.
I am
want
going to
the
time
timer?
myself.
Oh, yeah, no,
She timed me, so now we
I
know
did
it.
because I'm long-winded and I apologize. I get excited about things.
It's 8 o'clock.
I know, I'm sorry. All right, the big thing I want to talk about is Expo. That is next Thursday. It is October 21st from 6 to 8. I am so excited that we are offering this again. We're opening our doors to the community. Please wear a mask when you come visit us, but please come visit us. If you've attended it before, it's a chance to learn about community resources that we offer to families, students. It's about transitional services, so students interested in post-secondary anything. So whether it's supports that are needed or jobs and careers, we're going to have the CT open, middle school, high school. You'll hear from the programs that we offer in-house and as well as those outside resources. So we're very excited about that. Please, whether you are in pre-K or kindergarten or anything, please come and visit, because as your children move through our district, we're really excited for you to know what we're all about at the middle, high school, and CTE center. So it's a chance to just have a great time. We have raffles, we have swag, we've got a lot going on. It's a fun time. So come in when you're able, anytime between 6 and 8, and just enjoy. Come and meet us, chat with us. So very excited.
Games to make you feel really dumb.
There are some games and other things that we do with the kids, so we share it with our families too. I also want to share that there are several opportunities for the community to kind of work with us. So one of them, we're opening up a Q&A where people can submit something in writing to Mr. Robinson and myself. He's still here, awesome. And we're going to film our responses. So we're going to work with John on getting this out. So we're going to read your question and we're going to answer it. So whether it's what is our favorite food to what are you really doing with 3-hour detentions, I would very much like to respond to people. And so we're hoping that might be a way to be connected, but you don't have to show up for a meeting. Another opportunity is we have a couple of future learning pathway focus groups. We have Portrait of a Learner, so really looking at what are we doing beyond high school and how can high school support that. So that's in the newsletter. If anyone's willing to join as a parent or student, please do. And I have put out a request for parent input related to GPA, grade progression, and other kind of graduation-related things. I'm really trying to have a diverse representation in that group. So I'm looking for, I've already had a couple people reach out, and thank you to those who have, but I need additional representation for work-based learning pathway students or NCTE completer pathway students. So I'm looking for students, parents, someone on those 2 other pathways. We've got great representation in our scholar pathway, trying to balance that committee out. And anyone interested can find more information in my newsletter. She's looking at my time. Or call me, please, and I'm a minute over. I'm sorry, I did 3:11.
I give you credit.
Well, this is the good
Okay.
stuff.
I know,
You really don't want to shortchange that stuff.
I know my newsletter's long, but it has hyperlinks at the top. You can click it. It'll take you right to the part.
30 pages.
It's
She's going to keep going.
3:20. Go ahead, someone take over.
So if you want me to start, I'll always start and set the bar as really, really low with time. You know me. I'm short, right?
It depends.
All right, go.
Ready?
That is true.
Gotcha.
So, Nissa shared a lot of the stuff that I was gonna bring up as to things that are currently happening. During the PD time that we had, the teachers ended up working on data and created intervention groups, which we actually started this week in the area of math and reading. So we're really pushing it, and then we're gonna end up using the data all year long to continue to look at it, and we're gonna be tracking the student progress. So when we have parent-teacher conferences, which are coming up on November 12th, we'll start sending out a schedule to parents so that they can schedule the time. We're actually going to be sharing the data with the parents along with the report cards so they can end up seeing it. And then we hope to be able to do parent-teacher conferences again in the spring so we can end up doing, this is where your child was in November, and this is where your child is in April or May. Stop it.
Oh, sorry.
Less than a minute.
That was very fast.
54 seconds.
All right,
I was
I
not
told
ready
you.
for you to be at your end.
All right, there you go.
Good. You guys can all go home and I will stay here and tell the camera and the community what is going on. You guys can all go get dinner. But we have to make sure people know. So Renovation Advisory Committee meets the second Tuesday of every month at 6 o'clock. It's on Zoom. I think that's really important. We're in our marketing phase. So you see our Newport Tech Pride stickers. Everyone in the district will get one of these with a nice letter informing them about the renovation. But this is an opportunity on October 21st. This will be the big public forum to hear of where we are, to see concept designs, to see how the new layout would be, to get a handle on what it is we're doing, to ask questions, to push buttons, to look at the Harvey construction reports on what things are costing right now. So please come out on the 21st because this is a chance to meet the architects. Potential to see some people from the DOE because our big maps RV is going to be here in the front yard that shows off all that CT offers from the state of New Hampshire's perspective. I'd like to also mention that program advisory meetings where the industry partners come in, there was one at the end of September, and teachers in CTE, host that at night with us and meet with their industry partners. They got a chance to tour and give input on the project, which is really important. I wanted the board to know that the application is due on January 1st. I'm trying to carve out a decent amount of time to put that application together. It's going to be a big lift. I want to thank the administration because when it comes to certain meetings, I am putting the focus on renovation and work-based learning and the CTE team almost entirely. These guys have to really knock hard and be like, are you there? And I'm like, I'm trying. So there's a focused effort on those three things. These guys talked about the professional development days. We would like to invite you in May or April to come because CTE teachers are designing backwards around a project on competency-based education and the theme of the district. And so they will be presenting individualized or paired projects related to increasing either their understanding of assessments or curriculum mapping, anything with competency-based pieces and they're designing those now. So we'd like to let you know that there'll be an end goal to that in May, and we'd like to invite you. And then I'd like to finish on two highlights. One is the FFA went to UNH today, and they presented and competed in all of their forestry activities. They got to see the college and see what they have for agricultural programs. They also did all of their floral and plant identification contests, and Lynn Wharton took them and Sam Nelson took them today. I wish I could have been there to support that, but we are still doing our industry tours, which are great, every Thursday morning, 7:30. So they did great. We'll hear what the results of that were later. And I'd also like to just give a shout out to Eichenauer and Tommy Spiker. Eichenauer has worked with Tommy in his high level of expertise and has changed their internship project just recently to include welding. And Tommy came to me and said they gave me a budget of $5,000 to put weld equipment budget together for them, to tell them what they need. He will be not only setting them up for welding, showing them about welding, and taking the lead, whereas originally they had brought him on a project they had wanted to utilize him for, and now they have really built that relationship with him and are utilizing his skills and his interests to benefit the company. And it's just an amazing shift in kind of that mindset of that relationship with high school students and how much they bring to the table. Heather Wells has done an incredible job. So that is how I sort of want to cap out. that relationship we have with work-based learning and how important that is to our district, but the industry partners are a huge part of that. So thank you for listening.
Thank you, I appreciate that. Anything from you, Dr. Minahan?
Two things. for-
I'm not trying to be short, I'm not, there's too much good
Yeah,
stuff.
go ahead.
We got a few short.
I'm not.
So two things. First, I want to thank the board for tonight. You are in a really tough position, and I appreciate your listening. I do appreciate the crowd, even though there were moments that I wasn't necessarily thrilled. But for the most part, they were, you know, it was a good conversation and a good conversation to have. And so I thank you, you know, as a superintendent, I thank you as a board. I also want people to know, this is a little self-revealing, so I'll apologize. The coughing you hear is not COVID. I checked. So it's either allergies or a cold. No one should be worried. All right, what do I got?
Whoa, whoa.
Less than 45 seconds.
44 seconds, so you
Okay.
beat Tom.
Anything from the board?
I just want to, and Shannon, correct me if I'm wrong, but Shannon O'Connor does a great job with the transition. I'm assuming she's doing a lot of the transition fair stuff still?
Shannon O'Connor and Nancy Wilmot, who are the key people organizing the expo. Absolutely, we count on them. And yes, Shannon's huge on that.
So I'd like to pat myself on the back for the transition fair a little bit for that, but when we first put that together, she was really great. So I just want to be able to acknowledge her and know that she is instrumental in putting that whole fair together. So thank you for all you do. I think we need to recognize our staff that put in the extra effort for these things.
Absolutely.
And I, on a different note, I still just would like to reiterate about this board and about how there are 4 of us here, generally in, day out, doing our jobs. And it is very difficult when we have people elected onto this board that are not doing their jobs.
When is the last day to sign up for board elections?
It's like January 12th.
Yeah, we'll get that date out. I would like to say, this was a tough night, this was a long night. I know most of us haven't been home.
All day.
But I do appreciate everyone that showed up here. I appreciate the administration. I appreciate the teachers. And man, I wished I didn't have to make votes like that. But they are important, and caring about the students and caring about the staff is always our priority. And I think I can very safely speak for the entire board for that. So thank you all. I know it's been a late night. I know we still have a non-public. Briefly, brief as it can be, so I will take a motion to go into non-public under 91A 3-2.
Motion to go into non-public meeting 91A 3-2E, I think is what you had said.
Yes. Okay. I need a roll call vote. Russ?
Russ Medberry, aye.
Linda Wonston, aye.
Jenna Darling, aye. Okay. There may be an action, so we will come back out if necessary with that. Okay, thank you all very, very much.